to do so. And also, I am an advocate for Africa Dyslexia Organization, a fellow, of course, and then also I am the Ghanaian representative for Bloom's Development Center in Texas, USA, and I am a complementary therapist accredited. I also do advocacy for deaf communities, for the deaf community, okay, and then autism spectrum disorder and dyslexia. This is David Nana Amoah Mensah, and I care and manage children with autism spectrum disorder as well. So, in fact, today is going to be a wonderful time with all of you, and I believe that before we leave here, you would have the opportunity to share and to also learn. And afterwards, if you need any clarification with regards to anything, you can hit up and then we will see you through. So if you are ready, I am highly ready, and I've been waiting for this opportunity all this while. So I am highly ready. We're going to kickstart and we are good to go. All right. Now, today's presentation is going to be a wonderful one, of course, as I said earlier, it's going to be a wonderful one. And it's something that we all need to know as teachers, as practitioners, as parents, and also as heads of schools, that it is important that we understand supporting children with autism spectrum disorder, how to teach them at home and how to teach them at school. We are, as a country, at a state whereby we are looking at inclusivity in different areas, in our schools, in our hospitals, in our public places, in our private spaces as well. But then we need also to know and understand something. We have to prepare the environment for this people we want them to include. Now, when we talk of inclusivity, you should understand that at this point in time, it should be a point at which where whatever I feel like doing, I have equal opportunity to do them. It is not that I will be there and I am deprived of a lot of things. There is a need for me to feel included. And so the environment should be made possible to suit my needs. And that is what we are looking for. And if you're at school here, I will teach you and then I will let you understand why there's a need for you to have a special education unit in your school. Most of the time, you go for webinars, we go for conferences, we listen to approaches of inclusivity. Yet, when you go back to school, we don't incorporate them in our daily life activities. Then you have a particular parent complaining. You people are saying we take our children to school. When you take them to school, the schools are not ready to support them. I understand that because the school also have not put in structures in place to accept these learners. That is why today's meeting is very important. That after today's meeting, you will be able to set up your very own special education unit where if you are able to employ these strategies, inclusivity is going to go high, and we are going to have a lot of people coming in with regards to wanting to have an inclusion and also wanting to have a conducive environment for their work. Now, let's talk about autism spectrum disorder. Previously, during our meetings, all the speakers have done their possible best to explain autism spectrum disorder to you. And I am doing that, of course, today too, because probably we might have some people who are joining for the first time today. So when we talk about autism spectrum disorder, it is a neurological development condition, okay, that leads to communication, social, and behavioral challenges. This is the simplest you can definition I want to give across. It is a neurodevelopmental condition that leads to communication, social, and behavioral challenges. So you realize that, as I said earlier, the brain processes our thoughts. Everything that you see me do right now is because the brain has asked me to do. Therefore, the brain happens to be the mechanism that drives everything around us as individuals and as human beings. Now, we are saying that it is a neurological condition, which means that it's something that affects the brain. In that case, it has impairment in communication or difficulty or challenges in communication. It has also challenges in social life. For instance, my ability to understand my family, because I was born into a family, my ability to understand my friends, because I go to school and I meet them in school or I meet them in the community, there's a need for me to understand them. Now, because of my developmental processes in or during childbirth, I am not able to associate well, I am not able to connect well, and I'm not able to communicate very good. And in that case, I tend to behave in a way that people do not get to understand me. Hence, they term it as unappropriate behaviors or probably non-predicted behaviors. That is what it means. So in that case, let's look at some of the prevalence of autism spectrum disorder. So in just last month happened to be the awareness on autism spectrum disorder, the world celebration, and 2nd April happens to be a global celebration with autism acceptance. Yes. So most of the time we have updates from resource persons, research organizations, and other people coming in to give us updates with regards to autism spectrum disorder. And then this year, we recorded that 1 in 31 children globally, 1 in 31 children globally are affected with autism spectrum disorder. This was reported by the Center for Disease Control and Prevention. That is around April 15th, 2025. And we got to realize that 1 in 31 children appear to be autistic. Now, let's draw it down to Ghana. In our country where we are situated, and I believe some of you are joining us from Nigeria and Uganda and other countries as well. Let's look at Ghana, and I believe you can apply it to every other country you are coming from. In Ghana, around 1 in 87 children under 3 are affected. So if you have a children who are under 3 years old, you would realize that 1 in 81 of them are affected. And as at 2010, a study indicates that 38.7% of children under the age of 14 may have autism spectrum disorder. This was conducted by the Center for Learning and Childhood Development in Ghana. They did this research and then they brought these findings. Then I asked myself, what is happening? Now, previously, there was a myth attached to autism. This is not a new thing that is now coming and that we should be afraid of or we should be scared of as compared to the COVID pandemic. This is something that has existed all this while. It has existed in centuries and people have lived their life out of it. But now it is in the prevalence because previously there were a lack of knowledge and also there weren't adequate advocacy with regards to autism spectrum disorder. So if now you are hearing autism spectrum disorder and you are thinking that is something that is new, that is now in the system, understand that it was there in the olden days, it was there in the past. But it's because now we are making advocacy on it and we are trying to push the agenda that people should accept and be aware of autism spectrum disorder. We hear of it most often, and then we hear people being diagnosed of it. Previously, they keep them in the homes, they lock them up because they don't want to have society see them, or they don't want to have people get to know that I have a son who is autistic, I have a daughter who is autistic, I am autistic. We don't want to hear that. But now, thanks to advocacy going higher, we are trying our possible best to get autism to be a compound name so that everybody will not be at the verge where you have to deny yourself from being autistic. And in fact, being autistic doesn't mean you are not counted or you are not part of human. You are. You are. Yes, you feel belong because I always say that it is just as a matter of us being able to compare ourselves to each other. If you wouldn't compare, you would realize that those who are autistic are in their own world. For instance, if it appeared that all of us are autistic, it would appear that all of us are autistic, you would realize that then we are all going to accept how they behave and we will not have anything termed as autism or we will not have anything termed as a condition because we are all the same and so we accept it. But because we are a little bit different from them, we choose not to accept it. You realize that then that becomes the barrier between autism and those who are not autistic. So understand that they are from a world. Now, should you be born, and we are all told that as an average and a normal human being, you should have 3 legs and 3 hands. We will all accept it because when we are born, we see 3 legs and we see 3 hands. Therefore, we are all the same and we will enjoy being each other's keeper. Now, should you travel and go and meet some people who have 2 legs and 2 hands, you will come back and report that you have seen strange people. Hence, you tend to compare. So you realize that when you compare, you draw a barrier between the two. In this case, we are saying that those who are autistic have a way of processing their thinking. So those of you who have the understanding that, oh, if you're autistic, you cannot give birth. If you're autistic, you cannot get married. If you're autistic, you cannot work. If you're autistic, you cannot go to school. These are all myths. You can be autistic and do everything possible. You can't be autistic and do everything that you need to do. It is just a slight change with regards to your behavior, your thinking process, and how you do your things or how you regulate yourself. That is what we are talking about. So there's a need for us to understand them and then live with them. This is what we call the acceptance. Now we are aware. People are making noise on autism spectrum disorder. That is good. Now, if you hear it, are you ready to accept them? Are you ready to have them mingle in society? Are you ready to have them come into your space? Are you ready to support them when they need to? Yes, of course. There's a need for you to support them. There's a need for you to accept them because they are part of us. And this is what we are preaching to you so that you will feel part of the whole process. Now, when you talk about autism spectrum disorder, no autism is the same. In fact, it is not like malaria. Even in malaria, we have severities in malaria. You can have malaria and you have only bitterness in your mouth. Somebody can have malaria and be running, having running stomach and be coughing and other sort of symptoms. But then you realize that autism spectrum disorder too is the same. No one autism is the same. Even if you have twins and they are all autistic, they cannot be the same or on the same level. So we have levels with regards to autism spectrum disorder. This level is what probably misleads some of us, and that we tend to attribute autism to spirituality. Now, for instance, let's consider ASD level 1. If you are on the autism spectrum level 1, we have 3 levels, level 1, level 2, and level 3, as you can see on my screen. We have these levels. And if you are ASD level 1, which will mean that you are going to require support, but in this case, it will not be enough support in order for you to navigate through daily life activities. Although you would need support, but the level of support is such that you can even do away with support. That is what it means. Because you wouldn't need massive support, you wouldn't need intense support. So in that case, you see, you have difficulty in following social rules. Let's say, for instance, we are all supposed to be in a queue. In this case, you won't be in a queue, or you'll be in a queue, but then will not feel comfortable being in the queue. Hence, you might try to slide away from the queue. But when you are being called to come back to the queue, you will understand and come back to the queue. So you realize that interacting with people, autism spectrum disorder has a variety of levels. So understand this and do not compare one's autism spectrum to another autistic spectrum. No, it doesn't go that way. Everyone is different and they are unique in their own way. No two autistic are the same. It is never the same. So understand it from that angle. And at a point in time too, if you are ASD level 1, you realize that you may appear uninterested in social interactions, which will mean that if you are being forced to socially interact, you will do so. But personally, if we leave you to interact, you are not going to interact. So there's a need for us to come in and support you to interact. That is what it means. And then in this case also, we have difficulty switching between tasks. and staying organized and planning. So you realize that you will be having a lot of difficulty moving from one activity to the other, having difficulty in staying organized, organizing yourself. Like for instance, it's morning, we are going to school. Let's all dress up and go to school. You have difficulty organizing yourself to go to school, but with a little support. If I should give you your shoe, you are going to wear it. If I should give you your belt, you are going to wear it. If I should give you your trousers, you are going to wear it. Your shirt, your bag, you are going to keep everything, and then off you go to school. But then if you do not have this support, you are not able to interact, or you are not able to go with it. All right. And also, you would realize that we have ASD level 2. At ASD level 2, you will also require support, but in this case, you are going to require substantial support. It wouldn't be support as you will need as the ASD level 1 will. You understand? Your support is going to be a little bit intense than that of the ASD level 1, because he or she can be able to navigate, but then you will have a little bit of challenge. But then you will still be able to navigate around it. But you will need substantial support, not a lot of support. So in this case, you might have limited social interactions with a high interest and specific topics. So which will mean that this is where you find them being selective in a particular topic of interest. So you go to school and then we are learning mathematics, and if it's only if he is interested in that, that is going to sit down and listen to you. Aside that, he would not sit down. So here they are now getting intense. Hence, the severity becomes a little bit higher, and they get to be more selective at this point. So you realize that ASD level 2, you work on a particular child who is in ASD level 1, and you're going to work on a particular child who is in ASD level 2. When you try to compare the two, you are going to make a mistake. Understand that they all comes in level. That is why it is compulsory that you go for diagnosis. Yes, you go for diagnosis. And if you don't do so, you are going to treat, or you are going to relate with your ward wrongly. Yes. And also difficulty with verbal and non-verbal communication. They have difficulty with that. So you see some of them will not be able to communicate. They have delay in speech, and also they cannot process a lot of information given to them. So in that case, you would have to take your time and give them word to word, or probably short phrases, and they are able to work around it. You see repetitive and restricted behavior are more frequently. They are more frequent with regards to ASD level 2, because in this case, the intensity or the severity is getting higher. Now, when we come to ASD level 3, that is the highest stage with regards to autism spectrum disorder. In this case, you require a lot of support. Yes, you require a lot of support. That is why I'm saying that never in your life compare two autistic children. Do not do that, because you wouldn't know the level in which each child operates, or in which each child behaves. So in ASD level 3, this requires a lot of support. There's a need for you to come in all out to support these ones, because in this case, they have severe communication deficits. They are not able to talk. They are not able to communicate. So there's a need for you to come in as soon as possible. They need to help you to help them communicate. There's a need for you to help them interact. If you don't do so, you are going to end up not being fair to them. Let me put it that way. Yes, they may prefer solitary activities. You have them do things without even thinking of what is going on, and they don't have fear for danger. They are okay just like that. They are doing their things anyhow they want. Yes, because in this case, this is how the brain is telling them they should do things. And because you are not understanding them, you are also not ready to come to their aid or come to support them. So there's a need, and there is an importance that you should understand that no ASD is the same. You can have twins who are on the spectrum, even triplets who are all on the spectrum, but then they are not the same. Their severity might differ, their potentials might differ, where they find interest might differ. So do not compare. Don't think that whatever somebody did to a particular child can also help your child. No. That is why there's a need for you to seek expert advice. Go to the hospital, get diagnosed, and they're going to treat your child individually. Same way when you come to the school setting as well. You cannot treat an autistic child the same as you treat the other. No, you have to have an individualized educational plan for each individual autistic student. You don't generalize the whole thing together. You have to have individual educational plan for each of them because the severity amongst them differs. So these are the levels with regards to autism spectrum disorder. Yesterday, a teacher raised a concern. Why are we only talking about autism spectrum disorder and not talking about the other disorders? Yes, we are doing so, but then you'd realize that I said to her, you realize that the other disorders, let's say for instance, the one that's physically you can see, she made mention of Down syndrome, and I'm saying that probably autism spectrum disorder has no physical sign. You cannot point that, hey, you're autistic. Hey, you are not autistic. No, you can have somebody who's autistic, but in level 1, which if I tell you I'm autistic, you wouldn't believe. Yes. Probably maybe I am autistic ASD level 1. Somebody might be ASD level 2. Somebody might be ASD level 3. And on and on and on. You realize that we are not the same. So you cannot pinpoint. That is why there's a need for you to come in and then help these people when you realize that they are autistic because they have difficulty navigating their lives through their ways, their eating habits, their behavior, and how they socialize and communicate as well. Now, in this way, this is how you are supposed to see an autistic child in these levels. If someone is using my screen with me, I disabled that, but I think the person is doing so. All right, no problem. So let me just stop sharing and I'll share it again. Don't worry. Please, if you are the one doing that, kindly stop it, okay? I'll be very glad if you would stop it. All right. Thank you very much. And God richly bless you for being an obedient student. Okay. So I think we can move on now. All right. So ASD level 1, how I want you to approach ASD level 1 as a teacher or a head or a parent. Now, in their mind, people may see me as awkward, not disabled. So as I said earlier, they are able to do a lot of things by themselves, but they are not disabled. So don't think they are disabled. No. I can befriend or date. Of course, they can date someone, they can have a relationship, they can connect with each other, they can even grow out of it. But then autism is not curable. Understand that there's no cure for autism. There's no medicine that you have to take for you to be cured of autism. What we can do is that it's a lifelong disorder of which what can help is care and management. That is all. Nobody will get cured from autism and nobody has a medicine to cure autism. I don't know, maybe probably in the future, as research goes further and we keep learning, because we are still learning and we are still researching. Maybe you can come out with an antidote. But as it stands now, there is no cure for autism. All you can do is early intervention. That is very key. Early intervention is very key. You can come in and intervene, and then you would have them be able to navigate and do a lot of things for themselves. So in that case, I can handle change. Of course, ASD level 1 can handle change, but he or she will prefer routine. Okay, so put me on a routine. Let me know that this morning, this is what I have to do. In the afternoon, I have to do this. In the evening, I have to do this. I have to drink water, take water, sip it, cover it, and put it down. These are routines. I cannot take the water and do this. No, I have to take the water, open it, sip it, close it, and put it down. By so doing, you are giving the child the routine. So he or she goes over and over and over, and that is what they prefer. They can do the thing all right, but they want you to give them routine. And also they can fidget and they can do a lot of things. Okay, people might think that they delay or there are signs of laziness. So if you're a teacher here and you think your wards are lazy, no child is lazy. No child is lazy at all. Intervene and look at what the condition is and see how best you can help support them as well. So comparing it to ASD level 2, you realize that the severity now becomes higher and there's a need for you to do a lot of interventions. And same as ASD level 3 as well. There's a need for you to do a lot of interventions in this point in time. All right. Now, considering the key characteristics, if you look at autism spectrum disorder, there are a lot of signs you can compare, but then I want you to be on the lookout for this. If you're a teacher, if you're a school head, now look at social communication challenges, okay? And then also look at repetitive behavior, doing the thing, we call it one way, but this time around, you are doing it continuously all the time. You would realize that there's a particular object in the house or a particular toy in the school. Whenever he or she comes to school, that particular toy is what he or she will go for. Despite the many toys available, he or she will go for that particular toy. He or she will be going to that particular corner in the classroom. At home, you will see that he or she will be doing that particular thing. So you have them do tiptoe, walking on their toes, flapping of the hands. You see them moving like this. Yes, of course, that is how they get to do their things because it's a repetitive behavior. You see them humming and juggling, jerking, and other things. Yes, if you find them doing that repetitively, then you would realize that these are signs, and I need to hit the hospital. I need to go for diagnosis. I need to go for checkups as well. And also understand that if they have sensory sensitivities, okay, most of the time, those who have sensory sensitivities, they will cover their ear like this, just because they don't want to hear noise, or they don't want to hear extensive noise. It irritates them, or it disturbs their senses. Some will not prefer you touch them. No, they don't like it. Some would not like loud music. Some would not even like a particular color or a particular light color or a particular sensation. They don't want it, or a particular smell, even a particular taste. They don't like it. So probably you should be on the lookout for these things as well. And then also strength in memory. Yes, I'll let you understand why they have strength in the memory is such that they are able to recall a lot of things quickly. I'll tell you why. And then also the pattern and recognition, and then personal focus. Now, this here is personal focus. Most of the time, we want them to focus on what we want them to focus on. But then they have what they want to focus on. Yeah, so you see them staring at that thing for a longer period of time, or not even looking at you, or whenever they are doing something, they don't get distracted. But when you want to distract them, they get angry. That is how the whole thing is, and then they try to throw tantrums and other things. So as a teacher, be on the lookout for these signs. Sometimes, I'm not saying go and diagnose. Don't go and diagnose. Just look for these signs, and if you see any of them, sometimes a child can some of the time they get diagnosed at 3 years, at three, and sometimes it gets 6 years before you can see your child is autistic, or because you are not paying attention to the signs. That is what I'm saying. Be on the lookout for these signs. Just see if you see your child or your ward at home or in school having these kind of signs. Now that you are aware, you can approach and tell the person there is a need for you to see a specialist at the hospital. So therefore, go and see a pediatrician at the hospital, and they can best help you. Understand that early intervention is very, very key and very important. Don't go and say they are autistic. No, you are not the one to tell somebody's child he or she is autistic. You can suggest that this is what I have seen. And so I would advise you go and see the medical experts and you rest your case. Man, don't go and talk about it to anybody. The person who needs to hear it is the person you have spoken to, and that ends it. Sometimes the way and manner in which we, the teachers or the school heads, comes and talks about some of these things irritates the parents. Yes, of course. If I am experienced and then you come and tell me all this about my child, I will understand that you don't want the good of my child. Depending on how you say it, how you communicate it, that is why there's a need for you to see the experts because they have been trained in communicating. You see a psychologist, they understand how human brain process information, so they know how to communicate it. You don't just go and tell somebody that your child is autistic. The person will not take it lightly with you. So teachers, I beg you, what you can do, you are not in a position to diagnose autism. What you can do is that suggest, mommy, daddy, this is your ward, Kofi or Ama. When he comes to class, I realize that he likes playing with one particular toy a lot. Most of the time, you find him flipping his hands. I don't know whether he's happy or he's not happy. Most of the time, too, you see him throw tantrums whenever we are playing or whenever we want to assist him. I am thinking there will be a need for us to see a specialist at the hospital so they can clearly interpret these actions for us. For all you know, it is part of their developmental processes. But in case we don't see a specialist, we won't be able to understand what he is doing. If you say it this way, every parent in their right sense will know you want the best for their child. Hence, they will take it up and go in the lookout for it. But don't go and say, madam, have you heard about autism? Your child is autistic. Go and see a doctor. He's autistic. When you do that, they feel very angry and they might think you don't want the good for their child. So please, I beg you, do your possible best to know how to communicate this. If possible, just tell them what you have seen. I've seen him flap his hands. I've seen him juggling. I've seen him hit his head on the wall. This is something I think we should see a specialist. What do you think? Then they go in and then they help you with that. That is how you need to communicate it. All right. Now, let's come to the sensory issues or the senses. This is a very important part where I want every teacher to understand that most of the time, if you want to approach any autistic child or you want to help any autistic child, understand that we have what we call sensory sensitivities. Understand it. Don't say that whenever I go close to him, he doesn't allow me. Whenever I want to teach him, he doesn't allow me. Whenever I want to feed him, he doesn't allow me. Whenever I want to dress him, he doesn't allow me. Understand that they have sensory sensitivities. For instance, the eye. The eye, we have some autistic students or autistic individuals who have sensory issues with regards to their eye. What they see affect their senses, and also they become very sensitive to it. So probably where you want to take me to has a particular color in the room. I don't like it. Therefore, I will react to it. That is what it means. So be very, 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 very vigilant with regards to sensory issues. For instance, my ear, the hearing, we call it the auditory sense. In this case, some of them are highly sensitive to sound. Some sounds irritate them, plenty noise irritates them. I think there was a time I was walking one of my autistic students home, and I didn't want to pick a car. So I told him, today we are walking on by the roadside so that you get to see and know your environment. And that's also good. Most of the time, if you have an autistic child, walk with them in the environment so that they can know where they stay. Don't let it be from car home, car home, car home. They don't get missing. They won't know their way back home. So sometimes walk with them on the stretch. So after school, I was walking this boy home and I wanted to see how he's going to react to the environment and every other thing. Then I realized that whenever a motor passes, boom, this boy will do this. Doesn't want to hear the sound. You can see that sound irritates him or her. So therefore, when you go close to him with that sound, there will be tantrums. There will be a lot of the things you wouldn't like. So we'll know this as well. And then also we have the smell, what we call the olfactory sense, the smell, sense of smell. Sometimes they use these senses as a positive way and also as a negative way. You have somebody who is fascinated about colors. Yes, that's why I'm saying that no two autistic are the same. You have somebody who loves colors. You have somebody who loves sounds and they are always dancing and listening to music. Yes, But you have somebody too who doesn't like the colors, doesn't like the sound. They are all different. Same way, some people like smell. So if you are highly scented, yesterday, a parent was asking that why is it that my autistic child is going close to the teacher and not to the friends? Probably this is a child who has a sense of smell, olfactory sense that he likes. So he realized that okay, this particular teacher or this person has a perfume that I like. So they come close to you and even try kissing you. Some will try kissing you, giving you pecks and other things. If you smell good, or if you smell or you have a smell on you that they like, they come close to you, kissing your necks, trying to kiss you, trying to hug you, trying to feel you, just because they like what they are smelling. Some also get irritated with a particular smell. Same way as taste. On their tongue, we call it a gustatory sense. On their tongue, they taste a lot of things around them. So you realize that whenever they are tasting, some might be highly sensitive to a particular taste or probably a particular texture in their mouth. That is why their food and their intake of food becomes what we call repetitive. They only have to eat one particular food for a particular period of time. They cannot switch to tasting different food because in their mouth, they have taste sensory issues. All right. Same way as touch. Some will allow you to touch them. Some too will love you to touch them and even cuddle them as well. Yes, understand all these things. And some also the vestibular, what we call the vestibular or movement. Okay, yeah. Some will be moving in a particular way. Some will not move in a particular way. Some will be doing this and that. This is what you need to understand before you approach them. We have body positioning. Sometimes you have an autistic child walking in a particular way that you want to change that particular thing. Understand that when you change that, it's a sensory issue that's going to affect him or her. So let him rather change by you talking to him to help him walk around. Some of them, you have them walking, but their hands are up. Don't put their hands down. Some of them, when they are running, you see them like this and they are going. Some of them, too, they have no body position with regards to anything. Understand that it's a sensory issues. So you would have to now have it in mind whenever you want to approach him or her. If you understand all these things and you know the student you are dealing with, you would realize that you are going to touch him or work with him the way he or she would like, and then will accept whatever intervention you are bringing him. You understand? That is why even sometimes you go to a therapist and they don't even understand your word, but they first of all ask you, how is your word? They want you to explain so that they will get to know how to intervene. Yes. So there will be a need for you to also learn the students in your classroom, learn about them, know individual students, what they like, what they dislike, where their sensory issues are. Is it olfactory? Is it gustatory? Is it movement? Is it tactile? Is it internal? Something that comes from within? Is it anger issues? Is it temperament? Know all these things before you can come in to teach or to help them at home. If not, you are always going to find it difficult teaching them. If you're a caregiver at home, know the child you are taking care of. If you're a teacher and you have an autistic child in your classroom, know the child you are taking care of. Learn everything about his senses and then come up with how best you can help him as well. So you realize that an autistic child might possess all these senses. Let's put autism aside. Even we individuals, sometimes there are days whereby we have those who are asthmatic, where the moment you spray a perfume, they insult you. Yes, we have. I'm yet to see somebody who is cutting onions and will tell me he or she will not cry. You will cry. So you realize that all our senses are playing here. Same way an autistic child is also doing same. But in their case, because we think they are autistic, so we tend to punish them for doing that. We tend to punish them for crying. You wake up in the morning as a parent, and then you realize that you have muscle pull in one of your limbs. You tend to be ish, ish. Okay. Then some of you will even turn crying. Now, have you thought of your autistic child waking up in the morning and also having a muscle pull? You are able to process this information and know that it's a muscle pull, and that in the next in a few minutes, you are going to be okay. He is not able to do so. He wakes up in the morning and starts crying. And in other words, you start beating him, or probably you start hurting him, or thinking he just loves to cry. Understand that aside his autistic condition, he is also a human being developing. So everything that affects you affects him as well. Have you thought of an autistic child's emotions, how they feel? You as an individual, those who are mothers here or those who are wives, for a long time you don't see your spouse. How do you feel? Your husband, how do you feel? And if your husband's here, then for a long time you don't see your wife, how do you feel? You feel lonely. No matter even if you quarrel, you feel lonely. Have you thought of your autistic child where you leave the child at the care of a nanny or a caregiver for a longer time and you wouldn't want to attend to them? Have you thought of their emotions, how they will also feel? This is what you need to understand. Have their emotions come to play. When you cook and the food is salty, you as an individual will not eat. But when you cook and the autistic child food is salty, and the child doesn't want to eat, you force the child to eat it. And complaining that my child is autistic. If you don't force him, he won't eat. Meanwhile, the food they're giving the child is not nice. Doesn't taste good. When you take a hot tea or hot porridge, you react to it, but then you force it on an autistic child. When you are walking around and let's say a car should blow a horn on you, you get frightened. Yet you want all these sensory issues, an autistic child to take it because he or she is autistic. No. So you realize that we are really doing a disservice to them. And it will be very important that as time goes on and as we move, we understand that although they are autistic, they are also normal human beings developing. Hence, what we feel, they feel the same. What we do, they do the same. Understand this and they are going to be okay. And you realize that there isn't nothing like autism, because if you understand their condition and understand what is regulating around them, you will be able to accept them and then help them navigate through their daily life activities. So this is what I want you to understand as a teacher, a school head, and also a caregiver and a parent. The ABC analysis model. The ABC analysis model. Understand that before there is any behavior, there is an antecedent. There is an antecedent. Before any behavior, there is an antecedent. What is an antecedent? Now, you come and you find an autistic child with water pouring all on the floor. You go close to the autistic child and the first thing you do is to spank the back and beat him or her mercilessly. Why? Because he is worrying you and pouring water on the floor. But then you didn't think of the antecedent to that behavior. What triggered that behavior? The why. Why is he doing that? Why was he pouring water on the floor? Why was he pouring water on himself? For all you know, there's water in the bottle. He went opening it and was not able to cover it back. And therefore, the water spilled on the floor. Now, why was he going for the water? Now here, the antecedent is, I was thirsty. He was thirsty, and when he looked around, there was only a bottle of water. He went, grabbed it, and as he wanted to drink it, it poured on the floor or it poured on himself. This is what you should look at now. But then as individuals and as teachers, we only look at the consequence, the behavior, sorry. We don't consider the consequence. As every individual, whenever there's any behavior, ask yourself, why is he behaving that way? Sometimes as a mother or as somebody who is, let's say a wife, you cook and your husband is not eating. You ask yourself about why is he eating? Why is he not eating? Why is he not eating? Why is he eating? Why is he not eating the food? Why didn't he finish the food? You ask yourself these questions because you have seen a behavior of your food that you have cooked, not touched. Then you sit down to analyze. look for the antecedent. Why? Is he not hungry? Is he not feeling for food? Okay, then you go asking him and he tells you that, oh, I ate in the office or I ate whilst coming home. So you realize that this is what is happening to him and that is why he's not eating your food. So always look for the antecedents to their behaviors. There was a time a child, when you wear the shoe for the child will take it off. Should you say the child is very naughty? No. Look for the reason why the child is taking the shoe off. You realize that it's either the shoe is very tight or there's something in the shoe, a pin, a stone, or something that is hurting him or her. Don't beat him because the shoe is off. Check for what causes the behavior. Why are they doing so? And then you'll be okay handling a child with autism. Let's come to autism and screen. Sometimes we feel it is best that in order for them to learn, we need to give them the screen, the tablet, the computer, television, and phone. I want to kindly advise that if your child is below the age of 2, do not expose your child to any form of screen. I'm repeating again. Do not expose your child to any form of screen. I'm not saying this. Experts are saying it, and researchers are also saying it. Please and please again, if your child is below the age of 2, do not expose him or her to any form of screen, be it phone, tablet, or television. I will explain why I'm saying this. Some of you will think that, oh, my child learns better on the screen. They learn better on the phone. So you give them Cocomelon, you give them rhymes for them to view and for them to see. Understand that a child below the age of 2 needs to pick more and a lot of things from the environment. So there's a need for you to allow him or her explore the environment. Join communications when it's going on in the house. Connect with your friends. Play, jump, move all around. Forget giving the child a phone. They might throw tantrums, but then it is best that you don't give it to them at all when they are below the age of 2. Some would say that, well, my child will be able to learn. And you have some students go a long way to even slur. And you think your child is speaking like a white, and you are okay. You are happy. You love it. Trust me, they are not comprehending. In this case, you realize that most of the children that are doing, listen, if they are not from the state or if they are not in an environment where they are speaking that and they are speaking it, you try interacting with them and ask them questions. You realize that whatever they are saying to you is fiction. It's fiction. Disney World, Nickelodeon, Mickey Playhouse. These are the answers they are giving to you because these are the things you have fed them with on the screen. So the fact that, mommy, I want to drink water, mommy, I want to fly, mommy, they are saying all these things to you. Understand that they are not communicating. They are just mimicking what they see in the television or in the cartoons they are watching. There was a time I visited my auntie's son and he was running. And how can you run with your hands at your back? I know that when you're running, your hands should go like this, up and down, but his hands was at the back. Later, I realized that he was watching Ninja Turtle. You see how it's quite funny, but then please, I beg you, what they are seeing on the screen is what they are mimicking to us. So know that there is no need for you to give your child exposure to the screen when he or she is below the age of 2. It is not good. And even if you want to give your child a screen above the age of 2, there's a need for you to regulate it for them. They will tell you, mommy, they are giving us assignments. I need to use my tablet, my computer, and my laptop to learn. Please, I need it. So give it to me. When you do that, it is fine. It is very important. But then understand also that there is a need for them to relate, or there's a need for them to connect. There's a need for them to understand, and also there's a need for them to know that there's time for a screen. Regulate it for them. Regulate it for them, and they will be okay. If you sit down and watch with them, that is very good. If you're unable to sit down and watch with them too, you can help them navigate through it and they'll be okay. Have routines for them. Have a time where they can use it and where they can put it away. A lot of screen time affects the eye, affect their brain, affect how they think, affect how they process information. So please, I beg you, quit screen time and do a lot of interactions. When we were kids, we used to play Anshechu, Sansankroma, Ampe, and all those things. We had the social interactions with our friends. Now, what we have, what do we see? People and we meet in the bus stop, and instead of us to communicate, we are all on our phones because yes, we think that is the order of the day. It is wrong, and an autistic child should not be so glued to the phone or be so glued to the screen. It is best that you regulate it for them. When you want them to find, I know you want to teach them colors and other things, but it should be regulated. Don't leave it for them. They'll tell you that if I don't give me the phone, it's going to cry, going to disturb me. And in your quest not to be disturbed, you give them the phone, which is very wrong. So understand it. Now, it is very important also as a teacher how you support these learners. Early intervention, we are saying is better. That is absolutely good. But then there should be consistency in whatever you do. Here, consistency will mean that if you begin A, you should continue with A. If you begin B, continue with B. If you begin C, continue with it. Every day, it should be done continuously. According to my little research I've done, if you want a child to have a particular behavior, that thing needs to be done consistently for 66 days, and that becomes a behavior. If there are any interruptions within these 66 days, it tends not to stick. So you realize that when you were a child, you had a routine that in the morning, if you don't bath and brush your teeth, you're not going to eat. So even as you are grown now, in your own house, you can choose not to eat, not to bath before eating. But because that has become your behavior, you bath before you eat. It's because that has become part of you. That is why we are saying that whatever you want to do for an autistic child, there should be consistency in it. You should know that every point in time, there's a consistency in whatever you are doing. You shouldn't do it today and tomorrow you stop and no. That affects the process. So please have it in mind that consistency is key. And also individualized teaching with respect to the child's unique strengths and challenges. That is why I told you that there's a need for you to draw an individual educational plan. Listen carefully. Individual educational plan for your ward in the schools. So you realize that a particular child who is on the spectrum in your class, you have about 3 students who are on the spectrum. There's a need for you to draw individual plans for all of them. Don't draw one plan and say they should all follow. No, it is wrong, highly wrong, because their severity might differ. Their potentials might differ. Their strength might differ. Draw individualized plan for all of them. And in that way, you would realize that you are making progress. If not, you are going to have everything put together and you are going to struggle. Then you will say that I'm doing the thing, but it's not working. It's not working because you don't have an individualized plan for all of them. There's a need for you to draw a plan for all of them. Let them follow their own plan. Let them follow what they are doing individually. If you do so, you realize that they are going to have what they need. All right. Now, let's come to the school setting. Here, I want school heads and school teachers to take it very important and also very critical. This is where you can set up your small sensory room in your school to help that autistic child in the classroom. Now, there is the need for you to have a structured environment. A structured environment. What do I mean by a structured environment? You should make the environment very conducive for them to be able to navigate through. You realize that we are saying that there's a need for them to be included. But trust me, you and I know that if a school is willing to employ one teacher per child who is autistic, there will be much progress. Why am I saying this? If we are including them in the main setting or in the main classroom, then there will be the need for us to have other assistants or attendants who will also attend to them. Because if you put them in the main classroom, and you are having your main lessons, and probably there are some sensory issues going on there, you might find them throwing tantrums, which probably might disturb the whole class, of which I want to believe that is why some schools are not accepting children on the spectrum. But then, if it is so, we are saying that they need to integrate. There's a need for them to integrate. Good. Now, in the process of integrating, there's a need for you to also have somebody who will attend to that particular child. Yes. So that whilst you are learning or what you are teaching, if your child wants to move out, there will be that particular person who take the child out to go and move around a little and bring the child back to the classroom. Remember, I told you that they have deficit in attention, and some will not have expanded focus length. So there will be a need for them to move up and down. In order for them not to disturb your class, there should be an attendant in the class who will help that particular child. So every class that has an autistic child should have an attendant that will help them. And that is the way they can have or maximize the opportunity given them with the inclusion. If you have a class of, let's say, let me not go to the government side. Yeah, let me just stick to the private schools. A class of 20, because if you come to the government school, we have about 45 and above in the class. So let's look at the private school, or even the government school, 45 and above in the class. And you have one teacher taking care of them. Look at the stress. Even the private schools, even two, you, the parent that you have two wards at home or 3 wards at home. Let's look at the stress they're taking you through and compare a teacher handling 15 kids at a go. So there's a need for you to have a school to have an attendant to take care of a child who is on the spectrum and in a class where they are doing inclusion, so that the child will be moved around as and when the need arises and other things. And also, as I said earlier, the need for visual support is very, very key. That's why I'm saying that as a school, you can get a small room. Take this from me. Get a small room in your school. Yes, I would have wished that okay, I will be visiting some of your schools individually, unaware. Yes, I have your details. Yes, so I'll be coming to your schools to see if what we are discussing and learning here you are implementing. Sometimes we go for trainings and we hear them, but when you go back, we don't implement it. And so please, I beg you, for this one, of course, just take it for the ordinary autistic child. Please implement it in your school. All right. Get a small room in your school. Make the environment safe and conducive. Make the place very clean. Just a small room. I'm teaching you how you can create the sensory room for your child. Okay, for the autistic child in your school, so that when a parent tells you that, oh, can you admit my autistic child, you say yes, because you can accommodate him or her. So in this case, get a small room, okay, and there will be a need for you to employ a special needs facilitator, if possible. If you can afford to employ a behavioral therapist, a speech therapist, a pediatrician, any practitioner in the field of autism spectrum disorder, if you can employ them, it will be very good for you. Yes, it will be very good for you. So you get this small room and then you make it clean. All right, make it clean and decorate the whole place with visuals. Okay, depending on the sensory issues of each of them. You have the visuals there. That is why you see visual support is very, very, very keen, because they are not able to communicate. So this is how you relate to visual support. When it comes to visual support, for instance, if you are home and you want to feed your child, get a picture of food or a picture of somebody eating. Before you feed the child, show the child that picture. Show them that picture, because here we want to use visuals to communicate. So show them the picture. Do you see the picture? See, the boy in the picture is eating. The boy in the picture is eating. Are you ready to eat? Are you sure? Let's start eating. So once you are saying this, you are pointing to the picture. Then you start feeding him. So anytime you are done, you say finish or well done. We are done eating. Then you pick the picture for the food and then you put it down. We have done eating. Finished. Well done. Okay. If you want to give him water, take a picture of a bottle of water or a picture of someone drinking water, or a picture of a cup. And then you tell the child, this is water. We are coming to drink water. Would you want to drink water? Are you sure? Let's drink water. Then he takes it and then drinks it. You will realize that as he or she is doing that all the time with regards to every activity, they are getting used to the picture exchange communication system. In this case, you realize that when he or she is hungry, instead of him crying, these pictures are available, so he will go for them. Same way in the house. If you're a caregiver in the house, get these pictures. Now, some of you say that, oh, the picture will take a longer time for me. No. It's a gradual process. Understand it. It's a gradual process. So even if you want to do potty with them, even if you want to go hiking with them, everything should be visuals. I mean, the common things we do at home should be visuals. Should be in visuals, yes. Common things like bathing, dressing up, eating, drinking, using the washroom, playing, walking, all those things should be in visuals. Then you show it to him, you explain it to him, let him see it, you ask him, are you ready for it? So you realize that when these visuals are at his display, he or she will go for it and pick it up and show it to you. Now, we are all concerned about vocal communication. Have you looked at the different form of communication as well? Have you? No. Look at the current issue now in the selection of the Pope at the Vatican. We can all speak, we can all hear, but they choose to use smoke to communicate to us. Don't you think that they are teaching us the communication beyond vocal or beyond the voice? They have told you to understand that when you see a black smoke, know that there is no Pope. And we have all understood it. We are all okay. Okay, so we saw a black Pope and we say, hey, there's no Pope, and we start praying. Some of them are praying. Okay, that's fine. Now we saw a white smoke and we are all jubilating because there's a Pope. So you realize that beyond communication verbally, other things can be used to communicate. That is what I want you to understand. That if you make these visuals available to them, a time is going to come that when he or she is hungry, it can be 10 years, it can be 5 years. The cry and the worry of every autistic parent is that what will be of my child when I am no more? What will be of my child when I, the one taking care of the child, am no more? That is their worry. And so we are trying to come out with activities or stages where your child can be independent. Just look at your child being hungry and going for a picture of food because you have all the time showed him that picture whenever you want to feed him. And then he goes for that food. See the joy you're going to have because now he's trying to communicate to you that I am hungry. These are the visual support we are talking about. Please and please again, let's try this in our schools and let's see the magic. Also, there's a need for you to have an individualized educational plan that I've spoken about already, so I won't go much into it. And then positive behavior support. Whenever you see them doing something that is good, you will let them understand that it is good. Good. Do it again. You applaud them for that. And even if possible, you peg them or you hug them. You let them know that what they have done is good. So they might end up repeating it again. But when they do the wrong things, I've told you earlier that aside they being on the spectrum, they are also normal individuals developing. So you realize that they're not things that a normal child would do below the age of 2 or 6 will do. You find them doing it. When they do the wrong thing, let them understand that this is wrong. That is how you correct behavior. Don't say that, oh, leave him, he's autistic. Leave him, he's autistic. The day you want to correct it will be late. So when he or she doing something that is wrong, intervene. What you will do to a normal child, excuse my language, do to him or her who is autistic. You understand? There's a need for you to do the same thing to them because they need to learn. Yes, and then they will learn by doing. So when they are doing something that is wrong, correct them, but don't hit them because we now understand that the brain processing is different. So do not be angry. It takes a lot of patience, big heart to take care of someone with autistic. That heart is what I want to create, and we are creating together as well. And then also collaborative learning. Collaborative learning. We are saying that they learn from the environment. So there's a need for you to have them learn with their friends and have them connect with their friends. So I'm saying that most of the time, what I've seen in this inclusion section or inclusion sector is that one teacher to a whole student, and you have about 2 or 3 people who are there who are autistic. When you are done teaching the main student and you come back to the autistic student, you realize that you are even exhausted. Truth be told, I am a teacher, so I know you are highly exhausted. That's why I'm saying that there's a need for you to have a sensory room. So in that sensory room, you have who we call the special educational needs practitioner, who is in that room or who is there taking care of children with autism. So your child is in the main classroom, the main class setting. Because you have an individualized educational plan for that child, maybe 7 o'clock is circle time or assembly. 7 o'clock, the autistic child will join the main assembly. There's nothing like autism assembly. No. Let him or her join the main assembly. There's inclusion. They are singing, they are praying, they are talking, they are all there. Circle time, morning circle time, let him or her be there. Let her enjoy the circle time. And now we go back to the classroom to learn. Now, going back to the classroom to learn will mean that that autistic child will have to go to the sensory room to learn. That is the only way you can have teaching for the autistic child to be more effective, because we are saying that they have sensory issues. What if today in the main classroom lesson, my lesson is all about singing, and you know the students, when they're happy about singing, they shout, "Ah, la, la, la." Yes, and then you have the autistic child there closing the ear, sensory issues with regards to the ear. So you realize that he or she is not getting the benefit he or she needs. But then when there's a sensory room for him alone, he goes there. When his colleagues are also learning, he is also learning. When he is done, you bring him back to the classroom. When it's feeding time, they all eat together. When it's playtime, they all go to the playground together. When it's reading time, they all sit in the room and then they read together. When it's break time where they have to talk among themselves, because preschool, there are a lot of breaks in it just for them to communicate. So whilst they are breaking and they are talking in the classroom, that the boy is there also talking in the classroom. That is what we need to do. But when it comes to their learning, there's a need for you to take them to the sensory room and help them learn, because that is where they can learn. That is where the environment is made for them. When they are done, you bring them back to the main class. So you realize that they are integrating in the main classroom and then also getting the inclusion parts in their own classroom as well. That is what we call inclusion, where we are learning. I'm also learning. Where we are, inclusion doesn't mean that I am there. No, I should feel part of the process. I come to your house and you are all eating banku, and then you give me rice. Meanwhile, you know I would like to eat banku. How will you feel? Some of you, when you go for funerals and then you see you want to eat fufu and they give you rice, the way you complain. Yes, because most of the time you see they will tell you there's no rice, and immediately you see somebody eating fufu. Then you start making noise. Hey, fufu is here. Fufu is Same way you realize that they're trying to discriminate. You don't feel included. Same way that autistic child feels. So when there is teaching, he or she should also have his way of teaching and learning. Also, there should be breaks and moments because of their focus. There is no breaks and moments. Like, they are not going to pay attention to you and they are going to run away from the lesson. So whenever you are in a sensory room with them, you break, they walk around, they move around, they come back again to the activity, you walk with them, they play, they have some time together. If we should all do this will help you, or this will help us practice inclusive in our classroom or in our schools. So please, heads of school, this is for you. Let's do our possible best to do it. And trust me, the child in your class is going to thrive. Okay, let's come to the home. let's come to the home. Now, we are saying that at home, there will be the need for you to have routines. You have routines for them. Do not distort their routine. If 8 o'clock, you are all supposed to eat, 8 o'clock, please, let's eat. Unless they have feeding disorders. But even though, in that case, create an individualized plan for them, how to feed them. There should be the visuals at home. Remember, the same visuals used in school should be used at home, because if you do so, if you have, let's say, for instance, that's what I'm saying, that in this case, the school and then the home should meet. Let the teacher in school and the one at the home know what is going on in school, know what is going on our home. So the same visuals should be used at home and at school as well. There should be tax breaks, as I have said. So don't say they are home, nothing goes. They sleep at any time they want. They do anything they like. No. There'll be a need for you to have breaks for them, have routines for them, let them do things, and also making of choices. Now, this is where it's very important. Do not do things for them or choose things for them. We want them to communicate and give me feedback. So for instance, let's say if I'm going out and the child wants to follow me and the child is barefooted, I tell them, go and wear your slippers. Go and wear your slippers. In this case, we have said that some of them lacks communication or they have deficit in communication. So you would not want to burden them a lot with a lot of words. So there's a need for you to attach actions to it. Go for it. Go and bring it. Point at it. Take him to the place. Let him pick it up. You understand? When you want to serve him something, let him make a choice. Do you want this or you want that? When you do so, you are enhancing communication. But if all the time you make available everything that he needs for him or her, he or she will not have the need to communicate. If all the time you are doing things for them, they won't have the need to communicate. There should be a time where a child is going to pull your hand to a particular thing that he or she wants. Then it means that they are communicating to you that I want this, so get it for me or take me there. Then you see that he or she is developing gradually. Then you go to the next stage. The next stage will be that now when they come and drag your hand to that thing, you tell them to go for it. But this time around, you take them to where the thing is, and then you make sure that the distance between the thing and where they are is as short as possible, so they can pick it up. It's as short as possible. Remember, the first one, they have to come and call you, hold your hand, and take you to whatever they want or whatever they needed. That's the first stage. Second stage, we want them to build more confidence and also communicate a lot and be self-independent. So in this case, you'd realize that when they come to call you, that was the first stage. You go with them. Second stage, when you do that again and you go with them, make sure that the distance between the object and then where they are standing is such close that they can pick it from themselves. Don't pick it for them. So by so doing, they are communicating. They are enhancing communication. They are developing in communication. So you point it for them, pick it up, then they pick it up. The next stage will be that, in this case, now you have to now extend the distance a little. So you'll be doing that till a time will come, he or she will go for the thing, him or herself. Then there is independence. That is how we build connection with children on the spectrum. That is how we're able to connect with them and also make them have choices to choose from. We are going out, you are going to wear your shoe. I won't give you one shoe to wear. Most of the time, we force them to do things too much. Let them live their life. So I pick 2 shoes, or I take you to the shoe rack. Then I tell you, hey, Kojo, point to the shoe you want to wear. Although they are not communicating, don't think that they are deaf. They can hear. They can hear. The fact that they're not communicating, don't think they are deaf. That is why I always entreat parents that treat them as you would treat any other child. Send them on errands. Communicate with them. Mention their names. Talk to them. Although you're not getting feedback, you talk to them. One day, they are going to repeat what you say. They are going to answer you. They're going to understand. And they are gathering grammar and words that they're going to talk or talk back when the speech is developed. So let them understand that they are just like anybody. Talk to them. Send them on errands. Let them go. Let them come. Play with them as if nothing is happening. In that way, you are going to help them as well. And then also skill generalization. Most of the time, we have to practice school skills during home activities. Because what I've realized is that when students come back from school breaks or vacation, they retire. They retire, which is very, 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 very critical. Now, when they retire like that, the process changes because what we were doing in school, there weren't reinforcement at home during the vacation. So I beg you, what is going on in the school should be going on in the vacation. There shouldn't be vacation for an autistic child. The vacation will mean that we are introducing him to something that is fun, but not leaving him alone to do something. So let's say, for instance, okay, today in school, we are doing alphabet. When the child gets home, there should be alphabet recognition at home, where he or she can also communicate and also do same. So the school and the house should meet as well. And then positive reinforcement will mean that you would have to add, how do you call it? You have to add motivation, reward, hacks, and everything that he or she will need. Now, I say that the school and then the parents should communicate. There's a need for you to go to the school regularly if you're a parent. Here, this is where I want you to use your mobile phones. Please, if you're an autistic parent, a parent with an autistic child, or a teacher taking care of an autistic child, please seek permission from their parents before you use mobile phones or cameras to capture the awards. And here, I want you to understand that as parents or as caregivers, I am saying that it is very important for you to capture moments of your child who is on the spectrum. Why am I saying this? Most of the time, you go for therapists, and then the therapist will ask you, what do you want? Or what has been the signs? You are not able to communicate it well. So it becomes very difficult for the therapist to understand. So most of the time, you realize that you are not able to express yourself. Even depending on the mood that you go to the therapist with, you are not able to talk as you want to talk. Yes, so this time I'm saying that take videos of your child. Sometimes when you record those moments of your child and you sit back at your comfort zone and then you play back these videos, you are able to understand your word the most. For instance, taking the boy to the playground and then you take videos. You come back home and then you watch how he was able to interact with other friends, how he was there alone, how he was lying on the floor, can give you a signal. Okay, then which means that he doesn't like the noise. Okay, the green grass was itching. Okay, you see, when you do that, you are all the time updated on your child's status. So please and please again, don't use your phone for only Facebook or TikTok. Record moments so that you sit back and then you play back to know. In that case, you even get to know that your child is progressing or not. And so share and collaborate with schools and homes as well. Train. There should be training for teachers and parents most often. So if you're a school head here, please, wherever your school is located, find someone who can help train your teachers at every point in time, because me seated here, I am learning on the spectrum. Everybody is learning on the spectrum. We don't say that I have learned it and I'm done. No. Ever since I started managing children with autism spectrum disorder, I learn all the time because every day I see different behaviors. Every day I see different traits. Every day I see different things and want to work on it. So there's a need for you to have continuous development studies for your professional studies for your teachers, your parents, and those you think are in the school system. Please, there should be continuous studies. After this webinar, do not wait for another Autism Awareness Week for you to learn about autism. This is a stepping stone for you to go ahead and read more on autism so that you can understand it and help work as well. Okay, now we are almost close to how do you call it? The end of the session so that you can ask questions. So in this case, let's consider these two pictures. I wanted to play a video, but I didn't want it to interrupt, so I make them in pictures so that we can quickly talk about it. Let's compare these two behaviors. A child who is at the first time, the same child, though, first time he or she was happy. The next moment, crying and making noise, shouting. What can be the cause or what can be the problem? We have what we call meltdown. Meltdown, okay? So meltdown is when they get overstimulated. When they get overstimulated for a particular period of time, they get meltdown. So you see them doing some things that you wouldn't even expect them to do. So this child here was playing, very happy, cheerful, doing whatever they want, he or she wants to do. And the next minute, is yelling, shouting, and screaming, and even crying at the point in time. This is what we call the meltdown. So there's also confused, particularly with regards to social stimulation. So they get overwhelmed and they break down, and that is why they cry. So those of you who say that you are just smiling and now then or right now you are crying, understand that they have meltdowns. Yes, they all most of the time have meltdown. And so you see them crying, and next minute they are smiling. Yes, this is how the system is, this is how we are, and this is how we operate. Good. And then also we have what we call tantrums. This sign can be a sign of meltdown and can also be a sign of tantrum. Tantrum here is when they want something, they are in high demand of something, okay, and you don't give it to them. They tend to throw tantrums, cry, put themselves on the floor, and even hit their head on the wall and other stuffs. Yes. And then when, let's say, for instance, they want something, but you are giving them in bits, or you are giving, let's say, there is low accessibility of the thing, they can throw tantrums. So when there is too high demand of items, they throw tantrums. When there's also low getting of items, also they throw tantrums. Yes. Now consider this particular behavior. This is what we call stimming. This is what we call stimming. Now, stimming comes in variety of ways. We have physical stimming, we have vocal stimming, and we have visual stimming. Okay, yes. So physical, you see them chewing on any other thing, or let's say chewing on straws, chewing of bottles, top, and other things. Please, when you see them doing that, don't take it away from them. Unless what they are chewing can harm them, it's poisonous or very dangerous. So there's one particular man I know, I won't mention his name. He has realized that the son likes steaming and likes chewing straws. So he has bought plenty straws, and the child is all the time chewing it. Yes, they need to chew it. They need to chew it. So if you go to the some of the stores, they have this pacifier. Okay, but in this case, it's not like a pacifier. It's just something that they can chew on. Yes. So get them that so that they can be able to chew on. Now, this is what the chewing does. The chewing helps them calm their nerves. So if you see a child chewing or steaming on something, please don't take it away from them, because you might let them throw tantrums. Unless what they are steaming on is harmful and can hurt them, don't take it away from them. Rather, know what they like steaming on and get it for them. That way, they are able to calm themselves, because they do this particular activity to calm themselves. This is what we call the physical steaming. So some of them can be jumping, can be spinning. They can spin. You would think they're going to get hurt. They are okay. Oh, they are okay. So when they spin like that, just be cautious that you take away everything that can hurt them. Okay, and then you are always there when they are spinning, so that in case they want to fall or they want to get hurt, you can support them. But that spinning, they do this to calm their nerves. They jump, they flip their hands, they blink, they do all these things. These are physical steaming. And then the vocal steaming is when you see them doing when they do those things and you hear them making noise and making these sounds, don't shout on them to keep quiet. No. These are steaming they do to calm themselves down. They need to calm themselves. They calm the system down. So we have what we call the visual steaming. So you realize that They like arranging things in line. So you'll be at home and then they'll be arranging your shoes for you. You put the shoe on the shoe rack, and then the moment you come back, everything's on the floor, arranged in a particular line, a particular pattern. In the school, you put the books on the shelf. You come back and you realize that the books are being packed in a particular line. These are visual stimming. When they see things in that order, they are calm. They know they are achieving something. They are okay. They feel relaxed. They feel accomplished. So there's a need for them to also visualize the line that the objects are picking or the objects are taking, and they are highly, 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 highly okay with regards to that. Okay, and then also there will be a need for you to have age range. Okay, age range. That is why I most of the time dispute the fact that we don't have to repeat an autistic child in the classroom. Do not repeat an autistic child in the classroom. If you do so, the child is retiring. The child is not progressing. He is retiring. Age is very important when you want to manage autism. Age range is very important when you want to manage autism. So it is very important that you find somebody who is on the age range of your child. Let them play together. Let them do things together. They learn from each other. In that way, he or she will act at the same level of what you want him to do. Do not repeat them. Some will say that he's not talking. So if I should repeat, I should promote him to class 2 or class 3 or class 1 or class 4 or class 6. What is he going to say? Please and please again. Talking is not done in classes. Talking comes as and when you develop it. So it's the need for you. So if you want to tell me that if a child, we have autistic who is 38 years old and is not talking, you take that child back to preschool. Doesn't work that way. So let them move with their friends. And as they go, they pick traits, they pick characteristics, they pick behaviors from them, and they are good to pair themselves as well. And then also, because they are of the same age, you see them exhibiting the same traits, living their lives, and even learning a lot. And when you do so, it helps their progress. Trust me, I have experimented it and it has worked. It helps their progress. So there's a need for them to have their age mate around them, one friend, 2 or 3, take them out, let them go and explore, play with them, hug them. Sometimes they wouldn't like to be hugged or touched. Sometimes their little boy or the friend can touch them. But you should be there to regulate them, because sometimes when they overstimulate them, remember I've told you about tantrums and other stuff, meltdowns. They can lead to meltdown, and then they might try to resist their friends or try to even bite or pinch or push their friends. But it doesn't mean they don't love them. I told you the brain is processed in a particular way that will make them react in that manner. So you realize that. And also, according to my little research, anyone who is autistic and born into a family where there are a lot of children or where there are a lot of kids around, or the family are all around, the rate of developing is a bit higher here than those that they are born alone and they don't have anybody at home to communicate with. So this tells you that the need for connection, the need for socialization, coming together is very, very, very important. And once you understand that, when we do so, we're able to thrive as well. Now, let's look at this one. There should be the need for same activity. Same activity. It shouldn't be that you are eating and the autistic child is playing. If we are all eating in the classroom, we should all be eating in the classroom. If we are all playing, we should all be seen playing. If we are all using a particular activity, a particular thing, we should all be seen using that particular thing. If not, they won't pay attention to any activity you are giving them. Yes, and if you do it that way, you realize that it's going to go a long way to help us as well. And family time, I said, is very, very important. Let them bond, let them play, let them have fun, let them have the interactions, take them to the park, take them to nature, let them explore nature, let them have fun, live their life, Sunday school, Sunday classes, beach, parties, at the beach, please, at the beach, be very careful. You need to find the beach. The beach is good for them. Yes, it's good for them to see nature. But then you have to be very, very careful at the beach as well. Take them to the playground. Let them join their friends' party, church services. Let them mingle. Let them have fun. And I want to say that if you do so, you are going to have your world thrive as well. Thank you very much. And at this point, I would take some water because I've done 2 hours, 30 minutes of talking, 1 hour, 30 minutes of talking. Yes, of course, because this is very important to me. And I want to see every school practicing it. I'll be coming to your schools individually. I want you to see the schools practicing it so that at least you know that Hope Up Foundation Autism webinar series made an impact. Look at the people we have invited to come and talk to us, and we hear them and we go back and do the same thing. You realize that it is not, we are not being fair to ourselves. That is why I have spent all this time to talk about how you can strategize your classroom setting to do everything to help them. Please and please and please again, let's do our possible best to help them as well. If you need anything, let me know through Hope Foundation, and I'm highly ready to support you. At this point, I will take questions, and if you have any questions, you can unmute yourself and ask your question. Just raise your hand and I'll let you unmute yourself and you can ask your question. Okay. My dear Oluwa-san.
Good evening.
Good evening.
Oluwaseun.
Oluwaseun. Sorry. All right.
Yeah, thank you very much. Thank you. The webinar is very insightful. I have a concern about a child in my school. Ever since last term, that's second term, when he resumed, we noticed that he regressed. Like the level of the regression was so much that even till this third term, it is still affecting him. And it's so bad that before now, he was actually learning very well. But now he hardly participates in any learning activity except the one that requires physical activities like dancing, singing. And even when he starts throwing tantrums in the class, when you ask him to do something or sit, he keeps shouting, no, 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 and just starts running around the class. And even when you try to take him out of the class to the sensory room for him to be calm, he keeps repeating no, 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 and is not responding to anyone. And this is actually a big challenge. We've tried inviting the mother to let her know the need of her getting a full-time facilitator for him. But she has not been responding. She has not been coming up. Like yesterday, we were supposed to meet with her, but instead of her to come pick up the child, she sent someone to pick up the child. And this is really a concern for us because the boy is moving from preschool. By next session, he will be moving to primary. And I don't know, what do you think can be done?
Wonderful.
Thank
All
you.
right. Wonderful. Thank you very much.
Thank you very much.
Okay, so in this case, this is what you can do. Now, since the child has been diagnosed and we all know that the child is on the spectrum and trying to give the child an activity and he or she is refusing to do it, we have what we call the child-led activity. Most of the time, we plan activities for the children and we want them to follow, forgetting that they are also at a stage where their sensory issues need to be processed very, 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 very well. So in this case, you need to go with the child-led activity where you are going to let the child lead the activity. Look at what he or she wants to do for a day. Look at where his interest is. Where does he hit? Is it that today he doesn't want to be in the classroom? Does he want to be outside? Does he want to be on the playground? Does he want to be with a particular toy? Does he want to be at the seashore? If that is where he wants to be, let him be there. then the activity can be brought to that place. So you can channel whatever he's doing this morning, or let's say whatever he's doing now, into an activity. Let's say, for instance, this morning on his plan, he's supposed to have language skills where you are going to sing rhymes, you are going to teach him these two-letter words. This is an, this is on, this is in, this is do, this is run. You're going to, this is what you want to do for today. And you realize that he's not paying attention to that. Just leave him. You will see him go for if it's a play item, or let's say building blocks or something that he wants to do. Whilst he's doing that, you realize that he is calm and his attention is on that particular thing. Look at what you can do with that particular thing. So he's holding the building block. Okay, so we do what we call the child-led. You will see him pick building block of color blue, and you see him stacking. Then, which will mean that today he's not ready for language. He wants to stack, or he's ready for motor activities. So once he's stacking, you are just seated by him, and then you are counting. He wouldn't follow, but then as he stacks, you count 1, 2, 3, 4, like that. So as he's doing that, you realize that today's lesson would have switched from language to numeracy. This is what we call child-led. If not, you will not have him do anything in school at all. So whatever he wants to do, whatever he's doing, let him lead, and then you follow. So you see him stacking, you count 1, 2, as he's stacking. For him, you just stack, but you will be at the back counting for him to do. Same way, if he doesn't mind you, and then let's say he goes around touching things, you use that opportunity. You will see him go around and then will touch a flower. When he holds it or come close to that, you say flower. So you now let him learn words and recognition of objects. So you see him moving around, and when he wants to go out, you are going to the playground. You are going to the playground whilst you follow him. So he knows that this is the playground. When he goes to the playground and touches something, this is the seesaw. Wow, you touched the seesaw today. So you realize that you are teaching him what is in the environment instead of what you have planned for him. And that is what we call the child-led. So he is leading it and you are following it as well. Thank you very much. Yes. And I think also there's a need for you to help him get a teacher at home. As you said, my mother is not ready to do so. But then if you're not ready to do so, call in the mother and then teach the mother what she needs to do. But maybe there's not enough funds for us to go and pick a caregiver. So then you talk to the mother. Okay, mommy, today in class we learned about numbers. We did 1 to 3. Okay, so please, when you go home, please help him to do 1 to 3. In this case, you're going to do it this way. Teach them how you do it. You did it in a school. Teach them how you did it. Okay, I said 1 and he didn't respond. So in this case, I said 1, 1, 1, 1. Then I moved to 2, 2, 2. So you teach the mother how to teach the child at home. Maybe it's because of finances, he or she is not going to get, so they don't have to look for a particular caregiver. All right, Patricia Ama, you can unmute yourself and ask your question.
Good evening.
Good evening, ma'am.
Please, my question is, I have an autistic child in my class, and she's about to be 5 years, but she's nonverbal. She does, even if she wants water, she won't even say it. You'll be there and then she'll go for it. And then there are certain times she won't even go for the water at all unless you give it to her. And then there are times that even if you give it to her, she won't even drink it. So with someone like this, how do you go about? I just realized that some time ago there was this song we learned and we were singing at worship. And then all of a sudden she picked that song. So all the time, that's the only song you hear her repeating it all the time. But when you want to teach her, okay, say water, she won't say it. She doesn't say anything. So someone like that, how do you help her?
All right, sure. Thank you very much. So as we said, most of the time he or she would want to go for the thing himself. Now this is identification. he knows where the water is and he or she wants to go for it. Now, if there are things available for them to pick at a glance or for them to pick whenever they need it, then there's no need for me to come and call a teacher to go and pick it for me. There's no need for me to go and call my friend to go and pick it for me. However, we are saying that when there's availability of what I need, there's no need for communication. So most of the time, you'd realize that if you put things where they can see and pick out at every point in time, they don't need you in the process. They don't need you again. They will either go for it for them. So that's why we are saying that there should be a need where they will come and call you or even drag you to that thing, which will mean that I need assistance. Come and support me. Come and help me. And so when you take them to the place, now you let them pick it themselves. So as time goes on, now with regards to having the feeling or having a particular thing for or feeling for water or something, please take a critical look at her again. Take a critical look at her again. There will be a particular sign that she shows when she is thirsty, when she is hungry, and when she wants to do something. There will be a particular thing that you are going to see around him or her. You get it? Now, when you see those things, it should drive you to what they do. So sometimes I can be thirsty, okay? And in me being thirsty, instead of me going for water or requesting for water, I will do something else. Like for instance, play with saliva, or for instance, be chewing on my clothes or something that I don't usually do. You see me doing it. This is a behavior. Now, remember we said that we should look for the antecedent to a behavior. When they do that, just let them be aware. Okay, what is wrong? What is going on? What do you want? You see, mostly we don't communicate into their behaviors. Why are you chewing it? What do you want? When the child understands what, because you are saying the child can say no. So, which means that the child has a bit of language, knowing that no means I won't do what I don't want. So, which will mean that there will be a point at which where he will understand, yes, I want. So then, since we have breaks, that's why I'm saying that they follow a particular routine in order not to miss it. In the morning, we eat, in the afternoon, we do this. So at the preschool level, mostly we have breaks for water where they all go for water because we want to teach them you cannot get up and go to the washroom anytime you want or get time to go to drink water anytime you want. So we teach them. So you realize that around 15 to 20 minutes or 30 minutes at the preschool, we tell them all of you should go for water. So in this case, whether you are thirsty or not, you go for water. We tell you, okay, fine, it's a break. Let's all go and use the washroom. They all go and use the washroom. Yes, if you are feeling the wee or not, you have to go and use the washroom. When we do this, you realize that okay, he's not pointing for water or wanting to drink water, but they are giving him water. So the day you want it, he will come and request for it because he knows that there are times you go for certain things, there are times you don't go for it. This is a clear indication that the particular child is not put on routine. Let's establish routine for the child. Let her know what needs to come first, what needs to go beneath, what you need to do now, and what you need to do after. When that routine is established, there will be much progress. Now that she can say no, I want to encourage you and say that there's a need for us to do more and add more words and more grammar to his words. All right. Are you okay, Patricia?
Yes, I'm okay. Thank you very much.
Welcome, Mom. Thank you very much as well. All right. So, Mrs. Labby. Mrs. Labby.
Hello, good evening, sir.
Hello, good evening, Mom.
Thank you so much for the insightful teaching.
Welcome.
Please, I have a 4-year-old and we've been trying to potty train him. So we even have, I bought these steps that we put on the potty to make it easy for him to feel comfortable. And also we have visuals in the washroom showing a child peeing and pooing. But we've put him on a routine, as we said, a constant routine where, like, every morning he goes to sit on it, and every evening or maybe after he finish eating, but you sit on it then nothing will come. So I want to know if there's something more we can do. And the moment he steps out from it, then you do the number 2 or number 3. But when he sits on it, nothing will drop into the pot. So I want to know if there's something that we can do to help. So sometimes we even have to do it to demonstrate it to him that this is how it's done. I don't know if he's just not ready. Thank you.
Beautiful. All right. So let me just share an experience with you. Same way I was training a child and also wanting him to stop using the diaper. Yeah, so anytime we go to the washroom, we time the washroom. All right. So we do for the first that we look at how do you call it? We look at the distance and also the time frame within the washroom activity. So when we do that, you realize that we tend to prolong it or extend it as time goes on. I've been doing this washroom with a student and he's not getting it. Then one day, something happened. I went to the washroom myself. We went together, okay? And during the process of potty training him, I also felt I have to wee wee, okay? So I just let him stood there. He's a boy. He stood there and then I wee wee, and then he saw me wee wee, and then he came and looked at me whilst I'm weaving. Look at how the weaving is coming out and dripping into the water closet. The next moment, he came, stood in front of the water closet, and then drew his shorts down, and then started weaving. So there will be a need for practice to see. So we have what we call a practice-led intervention. There's a need for you to practice something for them to see. And most of the time too, you would, that's what I'm saying, that it is two ways. When you are doing potty, let the parent understand that, mommy, we are doing potty. So that is what I'm doing for your child in school. When he gets home, please, let's do potty at home as well. You'd realize that you'll be doing potty in school and then at the home, they are putting him on diapers. So the brain is not able to process the information very well. So every act or every activity you do with a child in school, communicate at home for them to also understand that this is what we are doing, or this is the stage we are getting to, and that we want to work on that for that point in time. If you're able to do so, you would realize that your child is picking. And don't be surprised when they go to the washroom and you don't see anything dropping down. For all you know, we don't want it. But the funny thing is that immediately you take them off the washroom, you realize that it drops. Now, what we want them to know is to go to the washroom by themselves. Okay, is to go to the washroom by themselves and know that this is where we do the things. So in the school, when it's break time and they're even going to play, take him to the washroom first before he goes to the playground. When they finish and they're going back to the classroom, take him to the washroom first before he go back to the classroom. When he wants to eat, take him to the washroom first. Let him sit on it, let him draw anything. The day something will drop, that is the day he will understand that the washroom is used to drop things we don't want. So therefore, he or she will pick it up. Yes, because you realize that most of the time, it's either he drops it somewhere else, not in the washroom, or not in the water closet. So this is what we want him to do. Take him there as and when. The day something will drop, he will know that this is where we need to ease ourselves, or we need to feel comfortable with whatever we are doing. And when it happens that way, that is the end of potty. And please, what I've realized about potty training is such that in the school we're doing potty, at home, parents will not want to continue with the potty and we're putting the kids on diapers. Please and please again, it is very important that when the school is doing potty, let's all bring forces together and do the potty. Don't wear diaper at home and come and do potty in school. It won't work because at home, they do it in the diaper. So in school, when they're not on diaper, they'll do it on themselves. So please, at home too, let's do the same potty. And if you have a child who is on ASD level 3, I've told you that the intervention is very, very critical and very, very, they need more support. If possible, whatever potty you are using at home, bring it to school. When they finish, take it back. If you can buy the 2 identical potties, you are good to go. You can buy 2, bring one to the school and keep one at home. It should be very identical. That whatever they are using at home is the same thing they will see in the school, so that they wouldn't have difference doing, because sometimes they don't actually want what they see in the school. They are used to what is either at home, or they are used to what is at school and don't want what is at home. So if you can buy the 2 for one to be in the school, one to be at home, that is fine. If you can also bring the one home to the school and take it back again too, that is fine. And if you do this consistently, you realize that in just in no time, you will be done with potty and you are good to go. I believe I've answered your question. Esther, you can unmute yourself and ask your question. Madam Esther, you can unmute yourself and ask your question. Okay. Madam Mina, you can ask your question. I see your hand up.
Okay, thank you so much, David.
Oh, it's Mina, yeah.
For the detailed presentation. So I want to contribute to something. You mentioned of screen time. I want us to know that David saying or talking about screen time doesn't mean it is a cause of autism. It doesn't cause, but it affects the behavior of the child. And also, we know, yeah, screen time is good, even if the child is above 2 years, just like David said, we need to regulate it and all that. Sometimes you can connect to a music box for the child to hear instead of watching the screen itself. And David, I think all what we've said since day one till today, I think we need to sit down and also talk and see how teachers can go about all these things, implement all these things, and be able to also care for other students in the class. Because sometimes you go to certain schools and they have only one teacher, there's one or two autistic children in the class. How will they be able to care for these two autistic children? And even if it is one, it is not easy. And still have eye on the other kids, in quotes, the normal kids. So I think we need to sit down and see how best they can go about all these things so that we educate them on it, so that other students will not feel neglected. Because if they also feel neglected, we know it also has another effect on them. So I think we can also look at this after the webinar. We can also make time, sit down and talk and see how we are going to help teachers, especially. So how to go about taking care of these autistic children and also not neglecting other children in the classroom. Thank you so much.
Thank you very much, Madam Mina. Madam Mina was the behavioral therapist who spoke yesterday for the behavioral perspective. All right. Thank you for your contribution. Madam Queen, Emil, you can unmute yourself and talk.
Hello, good evening.
Good evening.
Yes, so please, I have an autistic child in my class. She's just 2 years old. And I realized that sometimes, not always, sometimes when she comes to school and you bring her into the class, she don't want to stay inside the class. She wants to be outside at the compound, just playing and doing her own thing. So when something like that happens, what do I do as a class teacher? Should I send the whole class outside because of her? Or I should bring her inside the class for her to cry?
Okay. Right. That is so.
Yes.
That is what we were talking about. You see that you are the only one teaching the main classroom and then also taking care of the autistic child. And if you want the autistic child to have the full benefit of the lesson, there will be a need for you to have an attendance who will attend to the child whilst you also teach the main class. You cannot do two at the same time because you realize that they have these sensory issues. Probably maybe the class is too warm, or probably there's a lot of noise in the classroom, or the class is too dark or too bright that he or she wouldn't want to sit down, or the focus or attention span is not that broad that he can sit or listen or do something for a longer period of time. There's a need for me to get up and move. So that's why I'm saying that if possible, schools that are employing that are admitting learners on the spectrum, there will be a need for you to have attendants who will attend to these learners since you are put in the main classroom. You understand? That way, it's going to help the support and also it's going to help with everything that they are doing. If not, you cannot leave the main classroom and then go and attend to the child or take the children from the main classroom and bring one of them outside because the autistic boy is outside. Meanwhile, whatever you are doing, you have already set up everything in the classroom. That will interrupt the main lessons and other stuff. So please again, if possible, just talk to your head of school and let that look at how best we can have somebody again or as an assistant. I don't know. Let me ask you, are you the only one teaching the whole school? I mean, your class?
Yes, please.
Okay, so you realize that you are the only one
Good
teaching the
evening.
class. So please again, let's get someone to assist you, or you can suggest or make a plea to someone, to the head, to find somebody to assist you in the classroom so that you can either look at the mainstream and then that person also look at the autistic world as well. If there's any challenges, tell your head to call me.
Before that,
So let just let me know your head's number and I'll call and then explain the need why there should be somebody taking care of that particular child as well. Sure. Madam Esther, are you ready? Madam Esther, are you ready?
hello,
Hello.
can you hear me? Can you hear me?
Yes.
Okay, good evening. Thank you for the insightful education. So
Yeah.
my question is that I want to ask, at what age can you detect? Hello, can you hear me?
Yeah, I can hear you.
So I want to ask, at what age can you detect if a child is autistic? Is it when she's a baby or when she's grown?
Okay. All right. Sure. So
Because
because okay, sure. Continue.
because because my daughter is 2 years and
Mhm.
she's the same age of two set of twins, they are boys. But so now these boys are not able to construct one sentence. What you could hear them say is that that. Even if you ask them how are you, they're not able to say I'm fine. And they like crying a lot. You get me? I don't know whether these are signs of autistic. I don't know. I want to know at what age. Is it when they are grown to a certain age, like 2, 3, 4, 5 years, or when they are baby? Uh-huh. And also,
Okay.
what could be the cause of that
Mm. All right.
aside the genetic trait? Yeah.
Okay. Thank you very much for your question. Okay, so let's come to the diagnosis. At what age is autism being diagnosed? Now, most of the time, you'd realize that depending on the time you bring the child to the hospital, it can be diagnosed. But mostly in the early ages, let's say around if a child is
Okay.
1 year or 2 months or 8 months, 8 months, they barely do anything. You understand? So you're not able to see them. So sometimes you have people say that, hey,
Yes, ma'am.
me ba no not on your autistic. OD 6 years now you're autistic. It means that your child is autistic, but then
Mm,
previously when your child was young, there wasn't any character, any behavioral things that will give you a sign. Because maybe probably you know that
okay.
when a child is 8 months or 4 months, they sleep, they talk less, or they even mimic, or they even cry out loud and all those things. So it is when they are at an age where you will now require them to do certain things, then you will see that they are having deficits in some areas. Then there's a need for you to go and see the doctor. Because at the age of let's say for instance, 1 year to 6 years, and your child hasn't said mama or dada, or your child, you realize the child is crying all the time, the child is not giving you eye contact, the child is flapping their hands, then you realize that no, there should be a need for me to go and seek medical attention. So when you get there, you get diagnosed. All right. Yes. Some come in late, they get diagnosed at the age of 10. Some come in early too, they get diagnosed early. But what we are saying is that anytime you see anything wrong with your child or anything that's not going well with your child, do well to see the specialist. That way you are good to go. Most people are saying that the after COVID, most children are getting autism, or most people are getting being autistic, because there weren't any form of interaction, or we weren't having social interaction. So they were isolated, and they are now they had autism or something like that. This is something that we have to be born with. Okay. And even now with the excessive exposure of screen, there's something we call virtual autism. This virtual autism is what we get from the screen. So you realize that your child is going to have a particular behavior, which is not common. It's a behavior that he or she got from the screen. Your child is going to speak some languages, which is not common. Will be slamming and doing all these things, making cartoons, and not able to communicate. Because communication is when I talk, you understand, and they give me a feedback, a reasonable feedback, of course. Yes, but you realize that they are not able to do all these things. They get all these things from the screen, and hence then they get what we call the virtual autism. So in diagnosing autism, yes, please. Tomorrow, in fact, tomorrow's meeting, Dr. Gegisi, yes, will be available for us. I mean, trust me, she will sit down as a Mother's Day gift. She will sit down and then give you every details you need with regards to everything that your autistic child will. All right, so don't worry. She will handle this one for you properly. But understand that as at now, we don't know what actually causes autism. There are genetic factors, there are environmental factors, and even there are age-wise and every other thing that causes it. But we are saying that this can be common, or this can be contributing factors. Okay, but we're not saying that this is the cause for autism spectrum disorder. Good. So Doc is coming around tomorrow. So please, if you're a parent, if you are a mother, a father, a newborn baby, Doc will be available for you tomorrow. Bombard her with your questions, because seeing Doc tomorrow doing this for free as a Mother's Day gift is very, 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 very crucial. So meet Doc tomorrow. She will be here to answer everything that you need to answer. Yeah, she is a senior pediatrician and a senior expert in child development as well. So, Madam Esther, Doc will be here for you as well. And then if any other thing, just let me know, and then we'll take it from there. Vicky and San, you can unmute yourself and ask your question.
All right, thank you so much, sir. You see these children living with autism, they are very smart. And this is the case where most of you, what do I say, therapists will say that they have some sensory need. That is why they might want to go out of the classroom when everybody is in the classroom. Where do I draw the line as to whether there's really a sensory need, or the child is just escaping from being in the class? And then also, you see, for some of our teachers, as soon as they get to know that a child is living with autism, some kind of special care be. If I am a teacher, how do I handle a child like that, so that the other children, especially at preschool, do not feel that I'm giving that child too much attention, or making him feel too special, whilst the others are not being given that attention, even not with the children, but other parents. They might not even understand why you are doing that. Thank you.
All right. So you have two questions here: escaping from class, and then also special attention given to the child. Now, let me tackle the special attention given to the child. You'd realize that we are saying that there's a need for support. Okay, support will not mean that do it for them. Let's understand it. Support will not mean that do it for them. Support will mean that guide them to do what they want to do. So, for instance, we are feeding and we are all eating. All right. And in a preschool class, you know that when they see somebody getting attention, they all, Madam, me too, Madam, me too, Madam, me too. They all draw close to you. They all want that same attention. They all want to be cuddled in the same way. They all want to come out along in the same way. In this case, we are saying that when it happens that way, there will be the need for you to understand that this particular child needs support. So when you are supporting the child, probably maybe the whole class understands it at the level where maybe primary or year one or even KG2, they can understand that we all need to support that child. If you generalize the whole thing in the classroom for them to understand it, they will even help support the child for you. Yes, you have somebody who say that I want to feed him, I want to feed him. And as they come close to him, as they support him, as they help him, you realize that he's learning from them and even taking traits from them or behavior from them. So there'll be the need for you to let the class understand that, hello class, we have Kwame in our midst today. Kwame needs support. Kwame, we have to feed Kwame. Or let's say, and Kwame is on the extensive level. We have to feed Kwame. We have to help Kwame when he wants to go out. We have to do all these things. Who is willing to help? Are you willing to help? Madam. So you realize that they now understand why Kwame is getting the attention. So then they all come in to support Kwame for you. So let's say it can be the case whereby, hey, madam, I want to take Kwame to the washroom to go and wee. Madam, I want to help Kwame with his bag. I want to help Kwame to eat his food. I want to help Kwame. So you see, when the autistic child finds all his friends coming closer to him and drawing closer to him, giving him the affection that he needs, he will also learn and then grow from that angle. Now, drawing a clear line between what the child wants to do and what he actually wants to do, and then want to move out because probably you might be thinking he just wants to escape activities. When I'm yet to see a child who will escape chewing gum or toffee. Yes. When the activity is in their interest and they like it a lot, they will stay to watch, they will stay to listen, or they will stay to play. But remember that we are saying that, you see, we have a child who is going to have sensory issues, both in all the senses, even in all the 8 that we discussed today. They'll have sensory issues with all. And also, this draws me to the learning style and learning pedagogies. How do we teach in the classroom? Are we glued to the fact that students will sit down and watch the board? Are we glued to the fact that students will sit down and we write things on the board? No, understand that even let's put autism aside. Understand that there's a child in your class who is a visual learner, a child in your class who is an auditory learner, a child in your class who is a social learner, a child in your class who is a kinesthetic learner, a child in your class so there are a lot of learning styles. Now, in your presentation or in your teaching process as a teacher, make sure that you meet all these learning styles, because there's somebody there who, if he's not interested, for instance, you have a child who is a social learner, he or she learn in groups where you put yourself together in groups and then we are learning. And then you are all the time doing, can you hear me? Okay, we are done with the lesson, clap for yourself, That child will not even show interest. That is not an autistic child. So there's a need for us to integrate all that we do. And mind you, I've said that their attention span is not widened enough, so they cannot stay at a particular task for a period of time. But then if you are able to modify your teaching methods and strategies, you would realize that you have been able to fuse in social learner, visual learner, auditory learner, and all these learning styles in it. And then the child will feel belong, or the child will feel, I would stay. Yes. So mostly this is what we want you to do. Let's have some breaks in it, in the lesson, breaks where we all even go out. First, I quite know when we are at primary, when we feel like sleeping, they will tell us, all of you go out, run around the block and come back. When we did that, you see, it broke the bottom, and also it helped. So let's look out for activities that, if you realize that he wants to go out, let's look out for an activity where a child, all the class will go out. I mean, let's all go out and come back. We come back, you realize that the system is okay, we all sit down again. That way, the child has broken the activity and now come back to a different one, of course. I hope I've answered Vicky and Sam. Vicky answer, are you okay? Vicky, are you okay? Let me know if you're okay. If not, you can ask a follow-up question if you have any follow-up question. All right. So any question again? I think today I've been very exhausted. Yeah, I've exhausted all your time. Don't worry. It's because we want to put the message out there. All right. So any question? Any question again? Let me see your hand if you have any question. Annabella, you want to ask a question? Yes. Is there any question, Annabella? Okay. Okay. Mr. Francis, yes, you can unmute yourself and ask your question.
Oh, thank you very much for a wonderful presentation, David. My question is, I think today I've learned that, to be frank, we have, as facilitators or teachers, we have done more harm. Let me say that we've done harm to most of our learners, especially those with these signs that we have taught us, especially with the repetition. We may see a child in the class and think that they are not moving as we are expecting them. So repeat them. We repeat them and think that they will start harming them. As you said, they should move with their age mates and all classmates. So as they go along, they are able to pick up science and other things, and they also upgrade themselves in the end. So thank you very much for this wonderful presentation. I think we'll put them into good use and they'll be changing our various classes. Thank you very much.
Thank you very much, Mr. Francis, for the affirmation. God richly bless you for your time, for joining in, and for making this program a success. Thank you very much, Mr. Francis. All right, Annabelle, you can ask your question.
Okay, I lowered my hand because of my background noise. I wanted to ask, you were saying that we should treat them like how we treat, in quotes, our normal children.
Yes.
But in another way, also, you were saying that we should sometimes let them have their way, as in like maybe they want to do something, we should allow them because of the sensorial, the step. So I was a bit confused because I have one in my class who I'm trying to let him follow like some daily routines, as in the time of taking snack, the time to take lunch. But he also has his own way and the time that he wants to have his food. It's like he has made it up that maybe in every 3 hours or in every this, I want to have my food. And if we are not giving him the food, then he would be throwing tantrums, he'll be crying the whole day. But you see, when he takes his food too and the others are eating, then you'll be like staring at them and wanting to have another meal. So I was thinking that maybe I have to let him follow what they are doing so that they all be at par. Then it wouldn't be like anytime he wants to eat. So you saying they should have their way and then also we should also treat them. I'm a bit confused. So if you can clarify that one.
Okay,
Thank you.
sure. Having their way here would mean that because you understand their sensory issues, you are going to help them navigate through their sensory issues. But then you want them to pick up a particular behavior that everybody will be acceptable within the society. So here, treating them the way as you treat any other person is where you want to correct behavior. Okay, I'm saying that do not let them have their way with regards to behavior. There are things that they do that is wrong. I'm saying that every other child is developing the same way we are all developing. Just that in this case, we are saying that they are on the spectrum. So how we treat them or how we would understand them, we have better understanding. And because they are not able to communicate, their behavior is what they use to communicate. So you get it. Since they are not able to communicate, because the normal child can talk, the normal child, excuse my word, can tell you that let me use this word. The non-autistic child can tell you that I want to wee, I want to eat, I want to do all these things. But because they are not able to do so, they use their behavior to tell us. So it's not every behavior that you need to punish. And not every behavior that you need to condone. You understand? Sometimes in their quest to tell you something else, they do something else, which will be totally different. Here in the case, I am saying that understand what we call the antecedent. Whenever there's a behavior, look for the antecedent. What is causing the behavior? If everything is in the environment is okay, then now let's come to the sensory issues. Is it a sensory, something going on that he or she doesn't like? Okay, now you come in with your intervention. And looking at them following a particular pattern, it is a gradual process. Okay, a gradual process. Because we are all, let's say for instance, a child has sensory issues with regards to noise, and the whole class is singing, or you're having a jams, and you're all in the classroom jumping and singing, and sensory issues with regards to noise. There's no need for you to force the child in the classroom, knowing that the sound or the noise is irritating to him. No, you understand? So in this case, you have to, as a teacher, have to balance it. Know where the child sensory comes in. Know the child that you are working on. Get to understand the child. Then now you can know. Oh, sometimes when he does that, it means he's just playing with me. So I won't let something like that. So you get to understand. Because that's why I'm saying that no straight remedy can help two autistic children at the same time. Some it will help, some it will not help. So we advise that you take a thorough scanning and examination with your child. Look at them, look at how they possess, how they do their things, and then now draw this plan for them. So you realize that if you draw the plan, which will mean that this one on the feeding habit, he or she eats often or eats on regular basis, doesn't follow the timetable for eating. Maybe probably the child has a particular issue with regards to food, or the child has a condition in which the child has to eat quite often. In that case, we wouldn't want to see that. We would want to regulate it for them. So you find out, does he have any feeding disorders? If he doesn't, you take it. No feeding disorders. Okay, then why would you want to eat more? Is it that the food is nice? You take it. Okay, is it that he normally wants to eat just like that because there's food available? You take it. So you do all these self-analysis, and then now you decide, okay, fine. Since he doesn't have any food disorder, since he doesn't have ulcer, since he doesn't have any of these things, then this is a behavior that is not good, because you cannot be eating at every point in time. So in that case, let me regulate it for him. Then you realize that he's changing gradually. So there'll be a need for you to work in that regard as well. Mental Frimpong, you can unmute yourself and ask your question. Is it Mental Frimpong?
Hello.
Hello.
Yeah.
Madam Mental, you are being heard.
Have a child in your class. Hello.
Yeah, we are being heard.
Yeah. And first time, second term, and the child was really part into all the activities that we were doing in class. The third term, and the child doesn't want to do anything. Can you term that child as an autistic child?
Please come again. Your line was breaking. Come again.
I said you have a child in your class. First term, second term, the child was really involved in whatever you were doing in class. But it gets to third term, the child doesn't want to do anything. Can you term that child as an autistic child?
Has he or she been diagnosed?
No, please. But first and second term, that child was really involved in whatever you were doing in class. By third term, he doesn't want to do anything. So with this one, I'm a bit confused.
Okay, all right, sure. So we cannot say that the child is autistic because he or she show progress in first term, second term, and then third term is not doing so. You have what we call retire. Children most of the time will retire when it comes to developmental processes. Okay, some will retire, some would even not want to do anything for themselves again. Some will feel that probably maybe something went on. So you have to now look at the antecedents, look at what is happening. Go home and go and check. Mommy, when your child was in term, when we were in term 1, term 2, your child was doing good, but now he or she doesn't want to do anything at all. What is going on? What's going on at home? You would realize that probably maybe in the house during the vacation, the child didn't do anything. So which would mean that, say, let's say for instance, the most serious part is when they are learning how to write, and you teach them how to write, or you're teaching them how to write. And when they go home, instead of activities that will stimulate the pincer fingers and then gripping that will help them to write, they don't do any of this activity. So parents help them, parents do things for them, and the child is left idle. This child will come back the next time and will retire. Will not be able to do what he or she used to do. So it is not all the case that it can be a disability or autism. No, you would have to look at the antecedents. Then ask yourself these questions: what is going on? Then you need a background check. So you go home or you invite the parents for questioning. This is what is going on. I've realized this thing. What is happening? What did the child do when he went for the break? Where did you go to? Probably maybe the child traveled and something didn't go well. So all these questions needs to be asked. Then afterwards, you would give yourself some break. I mean, like some time, like 3 weeks, 2 weeks, and then try giving back the same attention to the child again. And let's see if she picks up. If she does, then in that case, the problem is from the home. When they went for vacation, she didn't do anything. We have parents who, when children go for vacation, the children are like queens and kings. They treat them like kings and queens. They don't allow them to do anything. In that case, when you have that happening, the child comes back and everything that has been taught in the classroom is gone. So you cannot term that as autism. Let's go back and trace what is happening before we can draw a conclusion with regards to whatever we want. Mr. Francis, you're back again. Mr. Francis, do you have any question before I pick Rebecca? Mr. Francis? Okay. Madam Rebecca.
Hello, good evening.
Good evening, sir.
Hello.
Good evening, ma'am. How are you doing?
Hello.
Yes, we can hear you, ma'am.
Hello.
Hello, we can hear you, ma'am.
Good evening.
Good
Thank you
evening.
so much for this opportunity. I have this boy who is. Hello.
Yes, please, we can hear you.
Hello. Hello.
Hello, we
Yeah, I
can hear
have
you.
this boy who is autistic, and he's not in my class, but it seems like the rest of the teacher, her class teacher doesn't really want to handle him, so he has been handed over to me. And the only time we can sit and be quiet is when I'm feeding him. He will throw tantrums, be biting me. The only time we are cool is when I feed. After feeding, even to get him to drink water, it's a struggle. He doesn't drink water. So when he feeds, he doesn't drink water. And I really want to help him, but sometimes since he's not in my class, I don't know how to go about it. He will sit on the floor, roll around, remove his shoes, be chewing it, be biting the other kids in the class. And like, it's a bit of a struggle for me. So I want you to help me.
All right. That's wonderful. So now let's look at transition children from one class to the other, or switching teachers from one class to the other. Now let's put autism aside. Let's put autism aside and let's treat it as a normal procedure. Now, you realize that even children who are being transited to a different class, or whenever there's a change of a teacher, it will take a longer period of time for children to adjust to the teacher's style and even like him or her. Yes, I quite remember the first time I was sent to the preschool to teach. Nobody liked me until I gave them my style, and they all died for me, and they all came to me. They are all dying to see Sir David. Yes, same way it happens to children. Most of the time, when they leave another class one to a different teacher, there should be a time for bonding. You should bond with the child. For all you know, the child who is on the spectrum that has been handed over to you is already used to that teacher. And you realize that coming again to come and getting to get used to you becomes a problem. Remember, we said that they have deficits in socialization. So in this case, it is up to you to look out for how best you can bond. It shouldn't have been a transition like this. It should have been that since they will want to give that child to you, you should be going to that child whenever he or she is free. Let him get used to you. Let him get used to your touches. Let him get used to your presence. Let him get used to your services. And then when you go for him, he will gladly come to you. But then if you do a switch change like this, from even let's consider a child being switched from a particular school to a different school, it gets very, very, very difficult for the first term, if not possible, throughout the year. But as time goes on, they adjust and then they're able to fit in. So what I will do is that let's get the old teacher, okay, the old teacher to come in, so that gradually you will also be introduced in the scene. Then the teacher can leave, then you come in. That is how you transit from one stage to the other. If you do smart transition, remember we said that they have deficit with regards to processing information and other things. Probably he's not used to you. He doesn't like you, or he might see you are going to harm him. He is used to now all the time I come to school and I meet Madam Georgina, and today you are telling me that Madam Christina is going to feed me. If it was you will eat, nobody will eat. Yes, exactly. That's the same way they also feel. I've been fed by Madam Faustina, and today you are telling me Madam Joyce is going to feed me. What if he's going to hurt me? I won't eat it. Consider that feeling. He's feeling the same. It's just like you being a Methodist and you are in Accra and you are being transferred to Takoradi. What you normally do is that you look for Methodist church in Takoradi to attend, just to strengthen your faith. You don't move to a different church again. Same way it is with them as well. When they are used to a particular person, they get used to you. It is you they want to see at every point in time. So now every child wants to see me, every child wants to see David. But then when you want to transit or move them from a different task to a different task, there shouldn't be this clear cut. There should be collaboration, there should be smooth transition, and that will help. But I believe I've answered your question. If not, let's see it in the chat box so that I
It
can
is not as if it wasn't a smooth transition. No.
okay.
That was his behavior in his previous class with the other teacher.
With the other teacher?
Yes.
Okay.
But I want to help. He's not supposed to be in my class. The class is supposed to be in. The teacher said she can't handle him.
All
so
right.
I was the nurse of person at her. So we are cool. When it's time for feeding, he will talk to me. Like he doesn't talk, but he will put his head on me and we feed. But after feeding, he doesn't really sit down. He will roam about, be rolling on the floor, picking the other kids. He will be tearing their books. And since like I am in that class and he is not in that class, it is a bit difficult for me to like juggle the two together.
Okay. I get the whole point now. All right. So, Madam Rebecca, what we will do is that let me pick other questions, and then what we will do is kindly hit me up back, and I'll call back so that we look at how best to deal with the issue. It is very good, and I like your heart. I like the fact that you want to step in and support that boy. This is what we want every teacher to do. Whenever there are obstacles, you don't complain. You go in there and then you do your best. That is what we want to do. I am highly available to support you as well. So hit me up and let's talk about it. Okay. All right. Sure. Thank you very much, Madam Rebecca.
Thank you so much.
Sure.
Okay, thank you.
Delis. Is that Delis? Did I get it right? Is it Delis? Is it Delis? Okay. Hello, we can hear you. Delis, your network is breaking. Okay, so if you can type the question in the chat box, okay, let me see. Someone also asking, is ADHD and he says, can a child be ADHD and same as autistic? Or is ADHD same as autistic? Is that your question? Okay, so let me see your question in the chat box. Okay. Yes, ADHD and autism. Now, a child can be ADHD, attention deficit hyperactivity disorder, and not be autistic. Yes. It can be ADHD and not autistic. You understand? Yes. ADHD is attention deficit. The child doesn't have attention. Yes, doesn't have attention at all. So in this case, you would need to see a behavioral therapist. There will be a need for you to see a behavioral therapist who will help you get attention. if you can be autistic, okay, and have ADHD, but you can be ADHD and not autistic. You understand? That is also a particular deficit as well with regards to special. Okay, so Dilly is saying, hello team. This webinar has been very educative. Thank you very much. And so far I have had some of the presentations. Okay, that's good. Thank you very much for the initiative. And we hope to have more of these in the future. Please, can we have the recordings of the, oh, sure, my dear, you have the recordings as well. So the media team will put everything together and then we'll share the link to you. I'm going to have the recordings and all the slides and even the contacts of all the speakers. So you can hit them directly if you want to hit them. So don't worry at all. This is what we need. We need you to understand what you're doing and then how best you can also come in to support the ordinary autistic child out there. So don't worry, you're going to have the support that you need and everything is going to be fine. All right. Any question at this point in time? Any question? Any question? All right. Sure. Okay. If there are no questions for now, let me put this across before we sign off. So tomorrow is Mother's Day. Tomorrow Sunday is Mother's Day. And for those of you who didn't join the first day for the webinar, the first day was handled by okay, somebody said, please, about the mental retardedness. Is this also a part of the spectrum? The retardedness, okay, you have a question. Let me take the question before I come to this one. Okay, so I'll come to that. Laurentia, Dafia Mekpo.
Yes. Thank you,
Wait,
Mihun.
please wait. Is it Madam Dafia Mekpo that I know? Piercing Edison?
Yes.
The name is very unique. Thank you. All right.
Yeah. So, if you have a child who has been diagnosed as being autistic and you are aiding the child in school and the child gets to primary, so what are we looking at? Because at the end of the day, the way we do assessment, if the child is doing the Ghanaian program, and even if the child is progressing and improving, there's no way the child can be assessed in the Ghanaian format. So sometimes it's difficult. It's like at the end of the day, so what happens to my child? I've paid school fees for all this time. The child cannot write the assessment, forgetting that the child was having differentiation and all that. And so the child was even having a separate type of assessment. But some of them want the child to do the same thing that other children in the class are doing. So this is a challenge that sometimes you can face. For those who are not even diagnosed, it's even worse because parents are in denial. So it becomes an issue. And how do we go about this, please?
All right, sure. Thank you very much, madam, for the question. It is very important that we normally will have to engage parents in meetings and also some of these meetings for them to understand that this is a spectrum and it's a whole different way when it comes to assessing or assessment. For instance, I have taught a rhyme in class and the whole of the term, my assessment is such that the kids should be able to sing that rhyme and I score them for their end of term exams or their end of term marks. Now, this is what I have done. And your child is nonverbal, and the child will have to sing the same thing for me to give the mark. It is what you want me to do. And I go ahead and I do so, and I score your child 0. Will you be happy? So they should understand that this is a spectrum and this also has its own form of assessment. Here in this case, we have drawn or we have looked at individualized educational plan, where at the end of the term, we have set a goal that this particular child should be able to achieve. And so everything that we have done from day 1 or week 1 to week 13 or 14 that the term has ended should be towards achieving that particular goal. So if we have done that particular goal and we have set that particular standard, I call you in as a parent and the teacher and then the school head. I let you understand, mommy, daddy, this is what we have for your child for this term. This term, you understand your child's condition, and therefore, this term, our main focus is to help your child with vocabulary, that is 1, behavior, which is 2, and then 3, social skills, which is 3. Now, on this note, these are some of the things we are going to do. When it comes to language and vocabulary, we are going to let your child understand certain words for the term. We are going to work with only 5 words or even 10 words for the term, and picture recognition and understanding. We are going to do this with regards to behavior. We are going to do this to at the end of the term. The assessment is going to be that has he been able to mention 1 or 2 words from this picture diagram? Has he been able to change with regards to behavior? Has he been able to do this? So if the school and the parents meet and we all agree on one thing and we move ahead, they will stop comparing the fact that they want to see terminal reports or they want to see exam papers to show that the child is progressing. So if we are able to do this sit-down meeting with them, an assessment, and assess and let them know and tell them properly, you are going to understand that they will now buy into the idea that there is a lot of assessments and not the one that we know that we are going to give you 100 over 100, and at the end of the term, we give you your report, and then you are first, you are second, you are third. In this case, this is a child on the spectrum, and this is how we are going to assess your word. We are going to assess him based on behavior, how he's behaving. So you realize that since we have an individual educational plan, we have a set goal for him. So you realize that this term, his behavior has improved by 1%, next term by 2%. So it's a continuous assessment. We are assessing him or her as and when he does the things. That is why I previously said that there's a need for us to use videos to record moments whenever we are giving interventions, so that you sit back and watch this video and know where you went wrong, where you touched wrong, what is he doing, where is he progressing, where is he retrogressing, where is he not coming in. And in that case, we'll be able to draw the line between progress, because so we can confuse movement with progress. We can move and we are not progressing. Yeah, so there's a need for us to understand this from this angle, and then sit down with the parents, draw an assessment plan for them. The parents, we all agree from both angles, and then we just come in and set it up or come in and help ourselves. So, Madam Lafemepo, these are some of the things I would want you to consider. Meet the parents halfway, you all come together, you draw the individual educational plan, look at how best we are going to assess. And even with the assessment, it's going to be different from each child, because every child and what they need and what they are able to do and what they are not able to do. So it now becomes an individual assessment. So there'll be a need for you to call individual parents and let them be aware of the individual assessment you have for the individual learners. That is how they have to go about it. And when they all agree to it, sometimes they are not of the known, and they are always in the lookout for terminal reports to see their child being first or last. But if you have such plan for them, they are all the time okay, and they will hit up as well. So if you have any other question, I know you have my contact and everything. Let's talk, and then I'll be gladly available to support your school and then also support you as well. All right. Is there any question? Is there any question? Is there any question at this moment? Okay, if there are no questions, okay. Tepo Esther, I can see. Do you have a question, or you are replying to a chat? Is there a question? Is there a question? Let me see your hand so that I can unmute you. All right. Sure. So if there are no questions, today has been a wonderful session, and as I said, tomorrow. Okay, said, please, how can a brain of such learners be worked on? I think I was answering the question before, Madam Lefemepo's question. The person who typed that question, please, you can resend again, okay, so that I can answer the question for you. Just raise your hand and I'll call you so that you can resend the question, and then I can answer it for you. But tomorrow we will have a session with Dr. Gazy, Yes, she is a senior pediatrician and a child expert as well. She will sit down and then talk to you and then take all your questions as well. Now, today was supposed to be the final day for our meeting, but then due to your request, Madam Esther, you have a question, right? Okay. Please show your hand so that your name can appear and I can unmute you. Let me see. All right. Esther Capo, I can't see you. Please show your hand, okay? Show your hand by using the icon, all right? So that it can pop up and so that I can unmute you. So I was saying that tomorrow, Dr. Gazy will be here seated for consultation, free consultation. It's free. Let's leverage on that and ask her all the questions we need, because when you book a session with Dr. Gazy, you have to pay a lot. And because she has the Love for Hope Foundation, and also she has agreed to support us. Let us all join in tomorrow and help and ask her questions as well, because she will answer to every question. If you need a certificate to the program, all right. If you need the certificate to the program, I understand teachers want to use this as a CPD to help themselves and every other thing. Please, if you need a certificate, a number will be placed in the WhatsApp group so that you can send your money to it. It's 50 Ghana cedis for the digital certificate, 50 Ghana cedis. So you indicate whether you want it via WhatsApp or you want it via email. Anyhow you want it, it can be sent to you, either via WhatsApp or via email. Yes. So your reference number, your reference should be your full name, how you want it to appear on the certificate. Okay, it should be your full name. It should be your full name. And if it's by WhatsApp, you let us know. If it's by email too, you let us know, and then we will send it to you as well. So if you have a pen, just write the number is 055 45 73731. 055 45 73731. The name is David Nana Amoah Mensah. David Nana Amoah Mensah. I will put information on the WhatsApp group as well. But then since we are all here, the number is 055 45 73731. 055 45 73731. The name is David Nana Amoah Mensah. The number again is 055 45 73731. Madam Doris, your hand is up. Zero 55 45 73731. Yes. Madam Doris, your hand is up. Yes.
Please, good evening.
Good evening.
Please, can you test the number for us so that
Sure.
we'll get it?
Sure. I'll post it in the WhatsApp group, okay, so that I can have it. But then also, I'll do it in the chat group so that you can have. Yeah, sure. So don't worry. Everything will be sent to you. All right.
Thank you very much.
Yes,
Okay.
sure. Sure. Queen, you can unmute yourself and ask your question.
Sir David, somebody is asking on the chat box that what about those that are outside Ghana?
Exactly.
How can they make it?
Exactly. All right. So those outside Ghana, we'll put up. You can pay via PayPal or you can pay via yeah, PayPal I think will work as well. But then don't worry, they are going to process it for you, and then we'll let you know what you're supposed to do. All right. So don't worry. Those outside Ghana, you are fully covered. I mean, I know we have one from Uganda and also Nigeria and in the US. So don't worry at all. Everything will be processed for you and will be added to the invitation, and then you have it. Yeah, so by tomorrow, you're going to receive a message with regards to how you're going to pay. But then, those in Ghana, you can pay via Momo. All right, is 055-45-73-731. In order for you to know that it is coming to me directly, that is why I'm giving you the name. The name is David Nana Amoah Mensah. This is the only name you should send it to. This is the only name that will appear for you to send the money to, not any other name. Yes. So don't let it be that you are sending it. Somebody will tell you I'm from Hope Up and so send it to me. No, the name is David Nana Amoah Mensah. 055-45-73-731. The reference should be the name that you want on your certificate. Yes, and that is my number to as well. When you call, you can either call or text or WhatsApp or anything. Just let me know if you want it via email. I will pick your email and send it to you, or probably if you want it via WhatsApp too, you can have it as well. So the certificate will start. We will start dispatching it Monday. Yes, on Monday. Okay, but you can start paying, and you're going to receive it from Monday because the team needs to work on it. Officially, I'm going to end this program tomorrow after the Tagazi has sat down to take your questions and consultation. Yes, and officially we draw the questions to this program and everything is done. A certificate will be sent to you starting from Monday. So as you pay, we record it and then we send it to you on Monday as well. So if there are no questions, I want to say that thank you very much for staying this long with me. In fact, today has been a very long. We are even looking at 3 hours, but then thank you very much for staying this long with me. I'm highly grateful, and Hope Up is grateful to have you as part of the Autism Conference for this year. Next year promises to be very exciting. Stay tuned and check on our social media platforms. We have other trainings coming on as well. So do well to check on our social media platforms on Facebook, Instagram, X, in TikTok, and any other platform. The name is Hope Up Foundation. Hope Up Foundation. Yes, if you follow us and like everything, you are going to receive the notification on most of our webinars and our trainings. We don't only do autism, we do professional training, teacher training, Montessori training, media training, church media training, and a whole lot as well. So do well to follow us on our social media handles so that when we post it, you will have a notification to see it as well. And we also look at scholarships coming in from different angles. So do your possible best to follow Hope Foundation. And on that note, I want to say thank you very much and God richly bless you for your time. See you same time tomorrow for Dr. Gaze's consultation and we draw the curtains to the autism program. Thank you very much and God richly bless you for your time. I really appreciate that and I don't take your time for granted. God richly bless all of you. Thank you very much and see you same time tomorrow. Bye-bye for now.